The information presented in this program is not intended as legal, health, or nutritional advice. All topics are provided for informational purposes only and are not necessarily endorsed. Neither Light On nor its host accepts responsibility for any statements, views, or opinions presented in this episode. All rights reserved.
It feels like all I hear are the comments. I don't know why. Because it's painful enough to pretend. The world itself is just one big hoax.
Among other things in this podcast, Adam Bigelsen and I spoke about the microscope images being shown as part of the experiment people took in 2020. Adam is adamant that nanotechnology is not being represented in images of the blood and vials by a number of people. As those images are not taken on the nanoscale and are normal artifacts he has seen in his work in the blood and other liquids. For me personally, this does not preclude the idea that nanotechnology could exist in these things, only that no one is seeing on this scale, and the images they are showing are not those exact things. In this episode, we do view artifacts in the aforementioned injectable products that, in my opinion, could very well be technology, albeit not nano-sized. This to me leaves the door open for more conversation and more discovery on A, why these images might be misrepresented by certain people, and B, if this technology exists, maybe we have yet to see what it actually looks like. As always, use your own discernment. Today I'm talking to Mr. Adam Bigelsen from the Bigelsen Academy. And so you've been quite interested in the blood for a long time, right? I know your family's been in the blood industry for a while, right?
Yes.
Yeah. What is so? Yeah, give me a little bit of a background. What is Bigelsen Academy? What do you guys do there? Yeah, what's going on?
Cool. It's funny because as you say that, all I can think is, yeah, my family's been into blood for a long time. We've been vampires for decades, centuries. So good question. Yeah, my dad was a very interesting person. He was a medical doctor initially. He was an eye surgeon, a trauma surgeon in Vietnam. And something went on with his life. It's funny because my brother Josh and I were the blood brothers. He's not here today because of some things we'll get into later on. Yay. He likes to stay with just the health focused experience. But my dad, interesting guy. He was his story. Someday we're going to do a documentary on this, damn it. He was born in New York, Brooklyn, right? And at a very young age, of course, grandma says, "What are you going to be when you grow up?" And he says, "I want to be a comedian." And a Jewish guy born in Brooklyn, you could be a doctor or a lawyer. It was kind of like, that was it. You cannot be a comedian, sorry. But he wanted to be a doctor at a young age. And it was funny, I think at the age of 7, he told my grandmother, "I'm going to cure cancer." And grandma said, "You can't do that." He said, "Well, that's what doctors do." I don't know any 7-year-olds that want to cure cancer. But as time went on, he did that. My dad, for people that are listening, watching, look him up. You'll find him on Quackwatch, which is where all the good doctors are. Right?
Quack Watch. I didn't even know there was such a thing as Quack Watch.
Nice. Yeah, you'll find him on Quackwatch. But the thing is, he was a Western medicine doctor. In the beginning, the way he tells the story is in medical school, he asked questions, and they told him to read the book. And he said, "I think the book is wrong." And he was told, or he was taught in medical school, what he says is he was not taught to think. He was taught to be a technician. When he'd ask questions, they didn't really like that. He said the first year they taught him what a normal body was, the second what an abnormal body was. They never taught him how one became the other. How is it that people actually are getting sick? So he questioned his schooling. He got drafted to Vietnam, and there's lies of the Vietnam experience, so he questioned his government. And then when he was in Vietnam, his hospital had a 98% survival rate. So he was getting results there. And then when he came back to the States, he saw that the hospitals in the United States didn't have that survival rate. So he questions his schooling, he questions his government, he's questioning the medical system. Eventually, he becomes an eye surgeon, and he's a rich eye surgeon in Princeton, New Jersey. Someone comes to see him for consultation. He recommends surgery, which is what he was taught. Person says, "Oh, I'm going to go do this alternative thing." So dad says, "Okay, great." The person got fixed. So my dad wants to help people. So he learned this new technique. which was interesting. It was a different technique. Next person came in with the same issue, so Dad was all excited to use this new technique, and he did it, and he fixed the person. The person had been to 5 other doctors who could not help her, so she was so excited she told all 5 doctors, "This is what happened. I got fixed." And all 5 of those doctors turned my dad into the medical board. They did not care the person got better. The egos just were concerned that they couldn't do it, and they didn't want this guy making them look bad. So this was not the first time my dad would get in trouble for helping people. But as he was doing this, he knew there was a different way to do things. What he says is he was in his 30s. He had all the money he ever wanted. We had the Porsche and the Jaguar. When I was a kid, we didn't have art on the walls. We had artists paint on the walls, right? So he had everything he wanted, and he said he was near suicidal. He was not happy. He was not helping people. It just wasn't what he wanted to do. And at one point, my mother goes to see a psychic, which Dad doesn't believe in, but happy wife, happy life. So go do the psychic, that's fine. And the psychic says, "I need to meet your husband. We need to talk." And this psychic was actually psychic to 4 presidents. Okay. I found one thing written on him once. My dad was with him once when the White House called. He had to go to Camp David with Jimmy Carter. So, as much as the powers that be say things like psychics are not cool, there are presidents referring to psychics. So this guy told my dad about the work of Edgar Cayce. Edgar Cayce, America's most famous psychic, the sleeping prophet. He goes into this trance or whatever, and he tells people about their medical experiences, and people get better.
Yeah.
So Dad learned about him, and then learned there was an Edgar Cayce clinic in Arizona. So when I was 8 years old, we picked up everything. We moved from Princeton, New Jersey. We gave up the Porsche and the Jaguar. We went to Arizona, and my dad took a 70% cut in pay. We got a Blazer and a Datsun. I wasn't really happy because we went from sugar to no sugar. I grew up on Captain Crunch initially, and then that switched over to grape nuts, and that sucks. So I watched my dad from an unhealthy, rich doctor go to something that he really enjoyed. He loved helping people. He was doing things. He was so excited when he would come home from work. He would say, "This person came in," and I was listening. This person came in with like muscular dystrophy or something. And then we did this, and this happened, and they're getting better. And I heard him talk about things that I know as a kid people didn't get better from. And that was happening. So my dad was on one side of the fence, went to the other side of the fence, started learning a way to really help people. And this point in the 80s, homeopathy was like the Wild West. Anyone could call themselves a homeopath. So my dad, what he did was he created the American Holistic Medical Association. You have the AMA, the American Medical Association. Now you have the AHMA. And the AMA has no jurisdiction over them. So they didn't like that. And my dad gave out the first homeopathic medical licenses in the United States. So any homeopathic medical doctors that are there owe their job to my dad. He wrote a law, okay? My dad was not a joke. He wasn't some guy who looked at the microscope for a while and went, "Oh, weird, cool." He did some really solid things. So he wrote a law. Arizona was the first state that had a law that separated the AMA from the Homeopathic Medical Association. He gave out the first medical licenses for homeopaths. He made sure they had anatomy background. So he legitimized homeopathy in the United States. Now, as time goes on, he was on Dateline in the 90s, and they made him look horrible. He was on Coast to Coast with George Norrie a few times, 4 million listeners. He's on Gaiam TV. You type up my name, Bigelsen, you'll find my dad out there, unless they've erased a bunch of his stuff. Now,
and what was he most known for? Like, why were they interviewing him?
He had a different approach. Once he wrote the law, then things started, like all of a sudden you're getting noticed. Like you don't just write laws. It doesn't happen, So Dad did something unique. And there are other states that followed after that. So word got out. Besides the fact that Dad was getting results with things that no one else was getting results with. And that's a problem in the United States. My dad wanted to cure cancer, and he did. And he became famous for it in the 90s. And then he got attacked for it. All right. He wrote a book called Doctors Are More Harmful Than Germs, which doesn't make you much friends in the medical business. And he was telling everyone, cancer, easy. Western medicine is totally backwards. And actually, it's not, they don't even care about you. All right. I don't blame doctors. This is not attacking the messenger type experience, because I believe that doctors go into that field to try to help people. What they don't realize is they were not trained to support the body. Now, as I say these things, I'm typically very careful with my words. All right. Western medicine, you don't throw the baby out with the bathwater. Trauma surgeons are awesome. Nurses are
Sure.
heroes. Okay. Most doctors look at the clipboard and don't even look at you. Right. They don't know how to read the studies. We learned this from Andrew Kaufman. Right. They prescribe drugs, and drugs suppress symptoms. All right. So that doesn't get the job done. Right. Now, there are people who go through the Western experience and things change, which is fine. So, like I said, I'm not here to just bash on them. In my dad's book, Doctors of More Harm Than Germs, he talks quite a lot about how good doctors are and the advancements they've made. But the reality is, Western medicine has not found the cause or cure of one chronic disease in over 100 years. That's a failure. Okay, it's a germ theory. Who has a theory for 100 years that still can't prove it? We've learned all these things. And for people listening, you can go look at Andrew Kaufman and Tom Cowan, Koch's postulates. Nothing satisfies that. Nothing's ever been proven to be contagious, things like that. We have diagnoses that don't make sense with what people have. Western medicine looks at symptoms, puts you in a box, and gives you a drug for that. I had a guy recently, 82-year-old guy, just went to a doctor, a real doctor. He has neuropathy in his legs. And the doctor said to him, "It's not my job to figure out why this happened." What's your job? His job is to suppress the pain. Okay. So these things too, the fire alarm goes off because there's smoke in the house. It's like the symptom in your body saying that something's going on. We can turn off the fire alarm, but we can actually deal with what's going on. So now my dad found a different way to work with the body. All right. He realized it was not the germ, like Claude Bernard and Antoine Béchamp say, it's the terrain the germ lives in. All right. A beginning botany student knows a plant is diseased because of the soil that it's in. It's the same with us, our terrain. We look at the physical body, energetic, emotional, and spiritual. It's all connected. Western medicine looks at you biochemically. All right. That's it. They don't care about your emotions. They don't care about what you believe. So we do, because we know those things, they have an effect. As my dad worked with cancer, one of his conclusions with cancer and chronic disease is, first of all, chronic is just a label that a doctor gives you when he cannot help you. That doesn't mean someone else can't help you. And I looked up a list when I was younger of chronic diseases. My dad helped most of those. Lower back pain is a chronic disease. We can deal with that. Okay. There are chronic diseases that are a big deal, and the ones that we call the bullshit diagnoses. All right. For us, we don't believe in autoimmune disease because the body will never attack itself. And for people listening, if you saw the Lyme disease movie, we worked with the producer. We worked with the whole Lyme disease community in our town where we were at. And Dad fixed every one of them, except one, because her husband thought my dad was crazy and wouldn't let her see my dad. Okay. So a lot of the things my brother and I say are things people have never heard before. And a lot of times they're the opposite of what people have heard before. But the reality is we share not what we think, but what we know from repeated experience.
Mm-hmm. What do you think Lyme disease is, by the way?
Lyme disease is a catch-all. Used to be Epstein-Barr. There are these diseases where there's over 300 symptoms of Lyme disease. So what that means is you and I both have it. Everybody has it. Okay? There's something going on definitely with the person, and everyone's unique. We had one girl that came in, she was young, and she would just cry all day and cry. Never seen so much water come out of someone. And the doctor said she's crazy. There's nothing wrong with her. But no, Dad saw there was a birth trauma. She wasn't crazy. And it's interesting because here's what Dad saw. Lyme disease, one of the patterns was an epidemic of surgeries, doctors. All right. But Lyme disease is an autoimmune disease for us. Autoimmune is something, once again, that your Western doctor doesn't know what's wrong with you or how to help you. So he says your body's attacking itself. It doesn't work that way. The body is trying to get you to live 24 hours a day, 7 days a week. All right. So you have, you're younger, right? And your birth is a little traumatic. Then you grow up a little bit. And then let's say your adolescence, lots of peer pressure, right? There's a little stress. Your parents, not the best environment, whatever's going on there. Then you break your arm. And later on, you got to get a surgery for something, tonsils are coming out and things like that. And then you fall and you hurt yourself. So at a certain point in time, you've got a leg that was never aligned. You've got a hip that's out of alignment because of the leg you've been walking on forever. You've got a surgery where there's a scar that's affecting energy flow, circulation, respiration. It's tight. It's pulling on the body. So what happens is, here comes a tick that bites you, and which they've never proven contagious, right? So it's like the straw that breaks the camel's back comes along. You're dealing with this and this and this and this and this, all this stuff, and something happens and the system just collapses. So that was the pattern my dad saw. Most of the time he saw birth trauma, something that had been going on since birth, and or surgeries. So you've got a bunch of different scars that are pulling. Scars are a physical and energetic block, right? And the scar, if I tuck my shirt in too tight here at my right side, I feel it over here. Okay, it's called a strain pattern. This is what the body workers deal with. So when you have a scar, it's not dead tissue, but it's tight. It's not moving. It's constricting, contracting. So if you're growing, it's going to pull. Most of the time, we've seen, so many times actually, we've seen structural issues. People are out of alignment. We had a woman in Spain, hip replacement. They want to do on her. She's in her 40s. We look at the blood. We see a scar. We see strain pattern. We see the hip. We start to put 2 and 2 together. She had a surgery. The scar is causing a strain pattern that's pulling the hip out of alignment. So we worked with the scar to release the scar tissue and align the body. And guess what? She never needed a hip surgery. She's off walking 10 miles a day. So scars are a big deal. Now you got little scars all over the body. You got scars in strange places. It pulls, and like I said, it inhibits circulation and respiration. It can affect digestion. If the scar over here is pulling your body this way, then your body's going to have pressure on certain things, different organs. Then you got a scar over here. Your body's pulling in a different way. These are adhesions as well. Doctors say adhesions are not a problem. They're a big problem. I have seen so many issues caused from adhesions. I have an osteopath that said to me once, he said, if you take peanut butter and put it on the countertop and put saran wrap on top of that, some plastic wrap, you pull, you can see the strain pattern. You can see where that is pulling. That's your adhesion. It's sticky. When they open you up to do any type of surgery, they move the fascia, the connective tissue, and it becomes sticky. It sticks to things. Now you have something that's pulling. So the osteopath said to me also, you keep that on the table for a year and the peanut butter gets hard, nothing's getting through there. That's what goes on in our bodies with adhesions.
So would you say that's more of like an energetic flow problem or a physical problem?
Both.
Both. Okay.
Both.
So it's multiple.
Physical and energetic. You got it.
Okay.
We align very much with Rudolf Steiner's 4 bodies. So when I look at the blood and we work with people, we're looking at the physical, energetic, emotional, and spiritual experience. I see emotions in the blood. All right. And like I said, this is not what I think. We've done this for decades. Okay. I got a clip of Andrew Kaufman talking about we were the ones that first taught him about terrain. And Dad was clinically successful. So this is not bullshit, as weird as it sounds for people. Okay. So
that's what I'm interested in, the emotions in the blood, though. I'd love to find out more about that.
Emotions, well, and his dad worked with cancer. Here are the patterns. Okay. His lung cancer patients, grief, sadness. In Chinese medicine, lungs are the organ of grief. And here's a pattern. Humphrey Bogart, the Marlboro Man, John Wayne, these guys all died of lung cancer. All right. It's not from the cigarette. There are people who live to be over 100 years old smoking cigarettes. It's not that causes the cancer. You have grief, sadness. These were manly men. Men don't cry, right? So you get stressed, you want to cry, you smoke a cigarette, it thins your blood. You can relax. So those guys did not die from lung cancer from smoking. They died from grief because they couldn't cry and let it out. My dad's liver cancer patients, anger. All right. Pancreatic cancer is one of the worst ones we see. Usually by the time they're diagnosed, they're almost done. We've seen some of them, but by the time, like I said, they're diagnosed, typically people go everywhere else in the world besides to us. And then when they got no more money and they're about to die, they'd come into our office. All right. With pancreatic cancer, the pancreas is self-worth. So if you feel worthless, that's not an easy one to fix. How do I instill worth into you, you know? And one of the things that like Kaufman and Cowan and these guys say is there's no contagion. So the reality is no one makes you sick and no one gets you better. This is on us. All right. We can make ourselves sick and we can make ourselves better. Not all the time. Louise Hay, you know who Louise Hay was with Hay House. She had like the Joe Dispenzas, Bruce Lipton's, they're all part of her publishing company. Okay. And she was one of the first ones that was pray your cancer away. Okay. And for people listening, you probably know who she is. When my dad met her, she came to him as a patient. She was living in her car. And my dad taught her about emotions affecting us physically. And she created an empire around that. Now, she couldn't publish my dad's books because her people thought we were too controversial for her, which is interesting. But my dad spoke to her once, it was funny, and said to her, Louise, I have a name for people who think they can just pray their cancer away. I call them corpses. It's my dad's sense of humor, right? So the reality is you cannot get rid of cancer without believing you can get rid of cancer. But if you come to us with a big tumor going out of the side of your neck, you need to cut it out, literally, physically.
I think that's a big problem too, right? Like, sure, belief plays a huge role in things, I think, but there's so many different facets to disease, different components, right? It's not one thing.
Right.
I think that's what people are really missing.
Yes, big time.
Mm-hmm.
The reality is your liver issue can be a result of your body being out of alignment, putting pressure on the liver so it's not functioning efficiently. It could be the result of a tooth because all the acupuncture meridians run through the teeth. So you could have a tooth on the liver meridian that's affecting the energies of the liver. Mm-hmm. It could be your anger issue that's affecting your liver. And even more than that, your structure can be out of alignment. So now your liver is not efficient, which is affecting your anger. You can't process it as efficiently, and it affects the energy of the tooth as well. And these are things, like I said, we've seen this over and over and over. Okay, people with lymphatic cancer, not everybody. So people listening, remember, I'm not a doctor. Lymphatic cancer, come to us with a big chunk of mercury right on the meridian.
Yeah.
Okay, it's crazy, but you're right. It's not. We are. It's like quantum's not the best word, but we're unique. We're multifaceted. My girlfriend would say, how many parts of you do you recognize? What makes you think you end at your skin when part of your respiratory system is in that tree over there? You know, I mean, these are important things to realize. Yes, liver cancer, anger, structure depending on, putting pressure on the liver, and then anger. Cancer patients, let's see, I had a guy recently, cancer in the mouth, and it came down to, in the blood, we see his elbow. Weird. And my dad's hero was Sherlock Holmes, okay? And I'll give you a little progression of how we work here too. Mm-hmm. My dad's hero was Sherlock Holmes, and he considered himself a medical detective. So he's looking for clues. He looks at the blood. He looks at you. He looks at the blood. He looks at you. He asks you questions. You know, it's a bit of a detective experience. So this guy, we see that the elbow, that's bizarre. Now, cancer, we know a lot about. Low oxygen, pH, it's a mold. Okay, it's very simple if you look at the homotoxicology chart, which is something Andrew Kaufman heard about from us as well. 2 Nobel Prizes have been won with work based on the homotoxicology chart. Doctors should know about it. Everyone should know about it. Mm-hmm. So meanwhile, this guy, we see he's got low oxygen is one thing, pH is off is another thing, because that's given with cancer. My dad said all his cancer patients, listen carefully, their blood was high alkaline, which makes us question the alkaline movement and things like that, right? Okay. There's urine pH, there's blood pH, there's saliva pH, there's pH in different places. But his cancer patients, and I still know the cancer doctors that worked with him, and they're still working with cancer, and they will say yes. High blood alkalinity, 745 and higher. If my dad could get the blood alkalinity down, you need 745, the cancer would die all over the body. However, if the person continued down the path of why they got the cancer in the first place, this is what you have. Cancer, many places in Mexico can get rid of your cancer. And then something different comes up 3 years later because they didn't get rid of why it showed up in the first place. All right.
But most people say that it's the acidity that causes cancer, right? Like it's acidosis, and all disease is acidosis, right?
Yeah, acidity where? That was the problem. Like I said, this is where people are drinking alkaline water, which goes into the stomach, which is so acidic anyways, it does nothing. You know, the reality is, what's the deal? And people were way into diet. My dad knew everybody. Okay, the Gerson Institute. He knew Atkins from the Atkins diet. My dad knew everybody, and they all knew him. Okay, the reality is your pH is a big deal. But you know what changes your pH way more than diet? Your attitude. And the movie Superhuman, the woman is changing her pH with the power of her mind. Woo! The guy's freaking out. We do this all day, every day. All right, this is why we need to practice joy. Bad thoughts change our pH. All right, and that affects us. So still, again, my dad, very successful with cancer. All right, he's written a few books. Read his books. We have people that are very famous for pH and saying alkaline experience. People are confused. All right, the reality is people need to learn about how the body truly works, and people have pieces to the puzzle. But this is a holistic, integrative experience. And by the way, when my dad wrote the law, the district attorney said to him, "You keep using this word holistic. What does this mean?" So my dad actually defined the word holistic for the Arizona legal system, right? So still, people are close, but they're wrong, all right? There's a lot of places in Mexico that get rid of your cancer. 3 years later, you have a different cancer. My dad's conclusion was it was a mold. You have moldy cheese. You cut the mold out of the cheese. 2 days later, there's mold all over the cheese. It's bad cheese, all right? So you can't just cut cancer out and then you're good, all right? So back to this guy, cancer in the mouth. Elbow, what's going on with the elbow? Good question. When he was very young, he hurt his elbow. It's showing up on the blood for a reason. Why did it hurt his elbow? I said, what was life like a year before that? Because we set ourselves up for disease and for accidents. So this guy said life was bad, not good at all. His dad was very abusive. His dad, they lived in the middle of nowhere. I think he was a coal miner, his dad. School was 50 miles away. Kid's young. He's trying to defend his sister. His sister, not cool. There's abuse there. Mother gets abused. So the kid realized whenever he got hurt or sick, it distracted them from abusing each other. So he gets sick. He hurts himself. They have to go to the hospital and all these things, right? He's distracting his parents. As time goes on, his sister gets pancreatic cancer. She dies. All right. And that's self-worth. This is because of what her dad did to her, that she didn't feel she felt worthless. You know, when dad abuses the child and takes advantage mentally, emotionally, sexually, you don't feel good about that. And you question why you're here and what's going on. So his sister dies. All right. The guy tries to tell his dad. Dad's in denial. He won't say anything. 1 year and a half. It was a year and a half prior to the death. The sister got diagnosed. 2 months later, he got the cancer in the mouth. Okay. Why? Something's eating away at him. Something he can't, we're molding. If you hold on to something emotional that just eats away at you forever, it's going to affect you physically. And his mouth, this was something he had to chew on. He couldn't say anything. You have to bite your tongue. He could have got tongue cancer. All right. There's a lot of very symbolic things that happen with these things. So he gets it in the mouth because he couldn't speak up and say things. And years later, his sister dies. Wow. And then all of a sudden he's got cancer in the mouth. So how does he get rid of this? He's got to go through some typical things to change the pH. He's got to oxygenate the body. And he's got to deal with the fact that he's got to give it up. He's got to let go of his dad. He's got to let go of that whole thing. And you know what? It's not easy to do. I had one guy, there's very few people that came through our clinics that didn't survive or really thrive. My dad would say, if I can't help you to live, I help you die like a king. And when people would come to us end stage stuff, we used to say we have the train wreck cases. And one of the last patients we had was hit by a train. Dude, how do you fix the body when you're hit by a train? There's only so much you can do. So the train wrecks would come see us. We did great with them, which was nice. But Dad saw the patterns. Cancer was an easy one. He actually went on the radio, late 80s, early 90s, like before internet radio, and said 100% guarantee cure for prostate cancer and breast cancer. And you'd think he would be famous because he was crazy, but he was doing it. That's when they started to attack him. And you'll love this. He was brought up on charges once of illegible handwriting as a doctor. He said one thing he learned in medical school is how to have a horrible signature. All right. They taught him you're going to sign so many prescriptions, just do it and do it and do it. And me as a kid, when my teachers would say, you have horrible handwriting, I would say, my dad's a doctor. And everyone would laugh. Even the judge laughed at this one, right? But my dad was brought up on charges of curing someone with illegal means.
Right.
All right.
Because you're not allowed to use any other methods in the United States, right? Except for like chemo.
Yes. In California, if you have cancer, it's a law. You have to have chemotherapy. All right. And what the hell do they know? Like, the government shouldn't be telling me what to do with my health. They don't know what the hell. The AMA doesn't even know what we do as holistic people. So they have no jurisdiction. That's why my dad wrote the law. And they didn't like that because they had no jurisdiction over him. And Conspiracy theory is only so interesting until they happen to you. We wrote the book on it. Literally, Medical Conspiracy in America is a book my dad wrote.
Mm.
It's out there. We sell it for $5. I think the PDF is out there for free. We have documented proof. What was his name? David Ben Asher, the head of the medical board at the time, said to my father, "We do not care that your patient got better. We only care about what you did." Right? So as my dad was concerned, and what he heard was, "Die in our hands, but don't you dare get better in a way we don't know or understand." And this is also a pandemic. It's like, dude, pandemic, give me a break. They don't care about your health. No way. Read my dad's book, Medical Conspiracy in America. Doctors Moral from the Germs is awesome. It talks all about the WHO and the CDC and the bullshit they did from way back. Right? Not here to attack anybody, right?
The CDC.
So yes, anyway, so dad was very real. I mean, he did things with cancer, and cancer is a very real diagnosis. It's not a Lyme disease diagnosis. And if you're listening and you have Lyme disease, I'm not saying there's nothing wrong with you, okay? It's a catch-all. There's something wrong with people. There's a lot of ridiculousness out there too. There's a lot of placebo effect stuff. You know, the Lyme disease thing is interesting because it's like a badge. Oh, I have Lyme disease. Oh, I bet you have Lyme disease. Oh, I'm in the club. You're not in the club. You know. So
it definitely becomes people's personality, like their sort of identity, right?
Yes.
Their diseases.
Yes, and this is my dad said. We had one patient, cancer, gone, and she's like, "Do I need to get another appointment?" He says, "No, you're good." And she says, "What do I do?" She didn't know what to do. Her whole life was managing this disease, and now my dad was like, "Go live your life." You know. So yeah, people get sucked into it. It's too bad when you hear the C word and you think you're going to die. It doesn't happen that way anymore. And at the same time, if you believe you're going to die, you're going to die. I had a friend whose mom, she got cancer in the brain, some type of brain cancer of sorts. And they told the woman, they said, "It's November." They said, "You're going to be dead by December." And it affected her brain in such a way that she thought it was November for over a year.
I always say they're casting spells. Like that's part of what that is they're casting spells on people. And I think there was even like studies done where they found that the amount of time they gave people to live would match up.
Oh yeah.
Right? Almost perfectly.
Placebo effect, dude. And the thing is, doctors have a way of making their predictions come true. People would ask my dad, "How long do I have, doc?" And my dad would say, "That's none of my business. That's between you and God." He would never tell someone that. That's what happens. She said they told her, "You'll be dead by December." But then her brain didn't work right. And she thought it was November for over a year. And then one day she went, "Oh, December," she died. It happens so often. People get a diagnosis and that's it. They just go. And I got to tell you, there's a lot of people that aren't interested in what we do. You know, they're not interested. You know, this is crazy. It's ridiculous. It's witchcraft. Dude, personally, if it was me and you said 100% of the people, if I got cancer, you say 100% of people with cancer get their pinky cut off and their cancer goes away, I'd say, cut my pinky off, right? My people would say, what's your success rate? My dad would say, I have a success rate.
Yeah, I wonder how many people really like look into the success rate of like things like chemo, right? It's pretty low.
Let's stop there though. Because if you get chemotherapy and they get rid of all the cancer and you die, if they get rid of the cancer first and you die, that's a side effect. That was a success.
Wow.
I shit you not, man. Look these things up if you can find them anymore. Okay, so part of it is understanding, my dad did something very real. Very real. There are people alive today who should not be, who were told they would not be. All right. So and actually they did a study on people that live to be over 100. One thing they have in common is they don't go for checkups. Doctor's always going to find something wrong with you. And no one's perfect. There's something wrong with all of us. No one's perfect. So get over it. Get out and be happy and live your damn life, right? Learn how the body works and learn to take care of your own health care. This is my job. I educate and empower people so they can learn to take charge of their health care. And it's awesome, dude, because Kaufman's talking to people about, why do you really need to go to the hospital? And there's not as many reasons as you would think to go to the hospital. There's a lot of things we can do to prevent going to the doctor and the hospital. But we don't realize that. This is what we've been taught. I'm an elementary school teacher, and I had to teach the Waldorf school here in Mexico English for a couple of years ago because the English teacher had a crisis. And I'm reading the book, and in the textbook, here's the section on health. And it's teaching fourth graders how stupid home remedies are and how dumb your mother is compared to a doctor. Right? It's teaching fourth graders to not listen to their mother. This is not cool, right? And doctors, I mean, like I said, nothing personal. They were taught certain things. The average lifespan of the average doctor in the U.S. is less than the average American. And my dad said deep down that's
Terrible
because,
health.
yeah, on pharmaceuticals. Yeah. And my dad said deep down they got to know they're full of shit. They're not helping people. Not the trauma surgeons, not the nurses, right? The ER doctors. So meanwhile, Dad was thrilled with what he did. He helped people that no one could help. And then you get attacked for those things. He was curing cancer. He wrote that book. And, the American Cancer Foundation makes a lot of money. When they call you to donate money for breast cancer, ask them how much they donate towards research. Used to be nothing, like very little, small percentages.
Huge. It's a huge, industry, business for them. It doesn't pay to solve anything there.
Yeah, there's no money.
I dated a girl years ago whose mother was a scientist, like worked closely with CDC and all that. And I mean, she told me if you don't get the result that they want, they will curb the information, or they will make sure you don't get the research does not achieve anything,
Yeah, that's when Kaufman said he was at Duke and he was starting to, I looked into something and he was like, why is this not being supported? And then he realized there was a lot of awesome things that weren't being supported. So that's why he is where he is now. When you look, you see these patterns. They're very easy, all right? So my dad, though, he did something good. He fought for his country in Vietnam, is what he said. And then he fought against his country for your health freedom, your medical freedom. And that's important, all right? These days, what's going on in the last few years, they have no idea what the hell. When the virus started, right? I said the V word. Dun, dun, dun. People were reaching out and saying, "What do you know?" And I had to think. I don't know nothing, because you know what? We never dealt with it. It was of no consequence to us. My dad never dealt with that in his clinics, ever. It wasn't a big deal. It wasn't important. He worked with HIV a little bit, but he didn't see any patterns to that one. He thought that may have been man-made or something. And my dad was all about patterns, right? So now, I want to show you just a quick little experience on what we do, how we do what we do.
Yeah.
My dad, and he didn't believe what he does, what we do. My dad did not believe it initially, all right? He did some things. He got to go on a trip around the world at one point with a guy named Burton Goldberg, was an author and a politician, if I'm not mistaken. He passed away not too long ago. Took my dad around the world and some other people to see what was going on with alternative medicine outside of the United States. Okay? The United States is not number one in everything like they say and they think. I think right now, number one is, I think the United States is number one in infant mortality. I think you have a better chance of being born anywhere else in the world other than in a hospital in the United States.
I believe it.
So meanwhile, Dad ended up in Canada with Gaston Naissance. He's a very famous microscopist. Mm-hmm. He has this microscope, the somatoscope, and he's looking at the blood live. My dad never saw that. Western medicine doesn't do that. They stain it. So it's frozen. It's like fixed. And they can always look at that sample. So my dad looked into the microscope with Gaston Naissance and saw things moving. And he got chills. He said, I need to know what this is. What's going on? I never learned these things. So my dad was the third doctor in United States history to look at the blood live. Royal Rife, Virginia Livingston Wheeler, then my father. Right? So as we talk about people looking at the microscope these days, I want to know if there's anyone out there that's had more experience than us. Because I don't think so. Not with the dark field microscope. No how, no way. I know where there's some people doing it 30-something years ago. I don't know who they are. So meanwhile, Dad was with Naissance. He was like, oh my God, this is awesome. Came back to Arizona, Scottsdale, where we were, and I got sick. I was going away to college in a week, and I got mononucleosis so bad I was showing minor signs of hepatitis. I was sick. I couldn't breathe. I just wanted someone to cut a hole in my throat so I could breathe. So my dad found a doctor in Arizona on an Indian reservation that used the microscope. This doctor, Friedrich Ploeg, he flew in the Luftwaffe. He was an ex-Nazi hiding out on an Indian reservation, right? And the Indians, the Native Americans, called him the Great Spirit. I get chills with this one too. This is the
Yeah.
things, dude. I don't know what we've been told. Is we're learning now all the things we've been lied to about. So we have to try to figure out what's true or not, right?
Yeah.
Either way, here comes ex-Nazi Dr. Plog, my dad, Jewish doctor from Brooklyn, right? And he looked at my blood with the microscope. He took some of my blood. He put it in this huge syringe. He put some remedies in there. He had me hold the syringe and think happy thoughts, and he shot it with a laser. He had me open up and say, ah, big needle, ah, shots in my tonsils. I can remember this so vividly. Dad, Jewish doctor, ex-Nazi, big needle. It's like one of these horror movies, right?
Yeah.
So he injects my tonsils, injects the remaining of what's in the syringe into my buttocks, and tells my dad I'll be fine. I can go away to college. The next day, my white count was down, like miraculously. My swelling went down. The coloring in my throat was bound to normal. And 5 days later, I went to college. And my dad said to this doctor, "You're going to come work in my office." So this guy worked in Dad's office, and then all of a sudden, the cast of Dynasty in Dallas, like Farrah Fawcett and Ryan O'Neal, all these famous people from the '80s start coming to my dad's clinic in the '90s because they know this doctor. And when the award ceremonies come up, he does regenerative stuff. He makes them look younger. Is using stem cells or other things. I don't know. Either way, this guy was somebody. So Dad's trying to learn from him, and he didn't really learn from him. The Berlin Wall came down, and this guy went back to Germany to find his family. And then another German doctor walked in the door. No coincidences. This 4 foot tall woman with big red hair, a cape, high heels, diamond encrusted cigarette holder. And she walks into the clinic and she says, "I am here." You have no idea who this woman is. She works with the microscope. Oh, interesting. So, and she's crazy. She tells us stories that are hard to believe. She works with the Pope's children. I didn't know the Pope had children. That's weird. Yeah, she worked with Castro and his cancer and things like that. Like crazy stories. So meanwhile, she starts doing this and Dad doesn't believe it. She's sitting with Dad and the patient. Patient in the middle, Silke Friedrich was her name. Friedrich Plog and Silke Friedrich. Dad's on one side, she's on the other side. Dad's looking at the microscope and he's guessing. He's saying, "Oh, how's your digestion?" And she's going, "No, no, no. Anything going on with your breathing?" "No, no, no, no. How's your physical body, your back, the structure?" And then she starts, like she's coaching him. And at one point, she says to the patient, she says, "When did you break your arm?" And he says, "I didn't tell you I broke my arm." So Dad says, "Can you excuse us?" And you talk to the doctor. And he says to her, "How do you know that? It's not on the history form. He didn't say it." And she points in the microscope. And there's a picture that looks like a broken arm. So my dad's looking at this image. He's like, "I don't believe this." So whatever. She does this for a year. All right. She's seeing things in the blood that are the cause of people's issues. All right. For example, the guy with the heart issues. He's got the palpitations, right? So she looks in the blood and she sees his structures out of alignment. So they get the osteopath to align the guy, his palpitations go away. We have people that have been to kidney specialists around the world. They come see us. We look at the blood. There's no kidney. There's the structure. Out of alignment, putting pressure on the kidneys. She saw things that Dad couldn't have figured out on his own, no how, no way. And then they got the results. They started addressing what they were seeing in the microscope. So we actually hired private detectives to see where these people learned this work, and we don't know. I think it came from Holocaust. I think they were experimenting on my relatives, on human subjects. But we don't know.
They were, yeah.
And the thing is, at this point, Patrick, nobody in the world does what we do the way we do it, regardless of what they say. We have trained some people. We don't talk to them. We don't refer people to them. I don't know what they're doing. Okay. But there's a lot of people right now doing live blood analysis, which is a brand. We'll analyze the blood live or observe it, but we do not do live blood analysis. That is a brand. It's also known as nutritional microscopy. Sells a lot of supplements, okay? You can take a 4-day course in live blood analysis, and now you're working. There's only one person I know in the whole world that does more than a 4-day course. So for what we'll get into in a moment or two, potentially, any microscopy images you've seen over the last 3 years have been done by people that have very little experience. Except for Robert Young. He's got more experience.
Yeah, we've had him on the show, and I'm going to ask you, we'll go into some of that stuff.
Yeah.
But so my question is when you say, "Oh, I see the elbow in the blood," or "I see, the heart in the blood." What are you associating with that condition? It's like a structure.
It's yes. Well, and everyone is unique. So we can see certain things show up in the blood. We'll see people have digestive issues, right? And we look at their blood and we see a lot of structural issues. Their structure is tight, compressed, they're out of alignment, it's putting pressure on the digestive system. The digestion problem is a result. Let me show you, I'll show you a couple images if I can do the screen share here. Hold on a second. Okay, yes, let's do a quick screen share and I'll give you the crash course here. All right, you see my dad there, and that's Jonathan Wright that's with him.
Yeah. Is that Einstein?
That's my dad.
Oh, okay.
Here's a weird one. Here's a strange one. And actually, hold on, let me switch this.
It looks like Albert Einstein.
yeah, that's my dad. Dude, here's an awesome weird story, okay? My dad, as an eye surgeon, my dad had Albert Einstein's eyeballs in his desk.
What?
Albert Einstein's actual eyeballs. Right. Okay.
Whoa.
Yeah.
Wow.
Yep, creepy, huh? His partner Einstein's grandchildren were his patients.
Wow.
So, and I have pictures with my dad and Einstein, like pictures next to each other, totally the same. So that's Jonathan Wright on my dad's side. He's very famous for allergy stuff up in the Northwest. He was the guy, if you never heard about the Great Vitamin C Raid, the federal agents, FDA, broke into his office during business hours. They broke the door down, even though it was open. They came in with machine guns, and vests on, everything, and they took all his vitamin C. Right, because that's not cool to have vitamin C. So he's got shirts. If you look him up, if it's still out there, he was famous for this. He had shirts. I survived the Great Vitamin C Raid. So my dad had some interesting friends, right? But however, Jonathan Wright, there's my dad, Dr. Moto. It's an older picture, so it's very pixelated. And Dr. Moto, what he did with the water was awesome. He tried to do what he did with the water with the blood first, and he wasn't able to do it. He was trying to show us how emotions affect us. And when he found out about my father's work, he was thrilled. There's a quote on the back of Dad's book about how it is Emoto's wish that Dad's work is shared with the world. And we were doing presentations with Misha Kohayashi, as the director of Emoto's Peace Project. But let me show you the work now. So the first thing we do is we look at a drop of your blood under a dark field microscope. All right, dark field splits the light so it doesn't go straight through the sample. We're going to look at your red cells, your white cells, your platelets, the plasma activity, debris in the blood. Then we're going to look at the other images, the holograms. So these are your cells. This is what people call rouleau, where it's stacking with live blood analysis. I see this in almost everyone's blood. All right, your blood can be up to 1 day old or up to 120 days old. When I look at a drop of blood, the younger cells stay towards the center for some reason of the slide, the older cells towards the outside. So the first thing I want to do is look for the best spot in your blood on the slide, because that's in your body somewhere. That's your potential. And I'll tell you, I can do this to blood just by taking a bad drop of blood. I have seen many, many, many people taking horrible drops of blood. As a matter of fact, there are a lot of images that people are seeing now. The COVID crystals, it's an air pocket with dirt. It's almost like so dumb, how could you believe me? These people don't even know how to take a good drop of blood. Once again, not that I'm here to attack any messengers. So here we have blood, all right? We look at a few things. We're looking at your red cells. These are your red cells here. Okay, white cell over here. I'll show you some more. There's a bunch of white cells. Platelets we look at. Platelets are how we monitor your inflammation. This is something my dad learned that was awesome. And Western medicine does a platelet count, but they do not take into account the size. Smaller the platelet, the more chronic the issue. The larger, the more acute the issue. All right. And weird things we can get into at some other time. My dad believed there's no human DNA in a platelet, is what we were told. He believes and was told somewhere, somehow, that it's a plant that lives with us symbiotically that helps us to heal and repair. Things I want to research at some point. But platelets tell us a lot about inflammation. Inflammation is how we heal. When it becomes trapped, we become inflamed, and then we have a problem. So inflammation is not the problem. It's trapped inflammation. Now, there's a giant platelet. This is a giant area of trapped inflammation. Debris, these little shiny things in the blood, they can be heavy metals and other things like that, or they could be air pockets with people that use filters on their microscopes because they don't work ethically. But these are debris, could be heavy metals or things like that. We don't care what it is. We know that it's not supposed to be there. And if we remove the blocks, things will remove themselves. The body does its thing. It's pretty awesome. And once again, it's the crash course experience here, right? This one, and there's a ton of stuff out there. So for people that want to know more, there's a lot of stuff out there on us. We got great videos and webinars and podcasts. So here's a happy white cell, my happy white guy. Different type of white cell here, red cells, little platelets here, bigger platelet here. Then the little guys moving around. These are the symbionts. Many names them throughout history. Bions, Wilhelm Reich called them. Endobionts, Gaston Isons called them microzymas. These are the microscopic particles of life that help us to create who we are and help us to decompose. Western medicine says they're fat particles. Okay, the reality is they can become fat particles, but this is like the force or your chi, your prana. They found these things existed in all living things, plant, animal, mineral. We've seen them in soil. We've seen them in animals. They found them in limestone millions of years old. Gaston Isons, the guy in Canada, he isolated one and he injected it into a dead rat muscle. And 30 years later, that rat muscle was alive in a jar. Right? This is pure life, these little guys. There is nothing more important in this universe as far as we're concerned. We can monitor your whole system by this. Too many, your body's working too hard. Not enough, that's a problem. Very interesting things you can learn from these. All right. So this is the basics of it. Then, this is the plasma activity. We see different amounts. This one is not easy to see here at the bottom, but we see it like a snowstorm sometimes. It's almost like your body's electromagnetic experience as well. For people that are truly EMF sensitive, we see the snowstorm. So there's so much going on in the body, it's like you turn on a light, and it's like, whoa, it's a shock to the system. A lot of people we see that are EMF sensitive are crazy, unfortunately.
Yeah, it's kind of psychosomatic, you think?
Oh yeah, totally. And dude, come on, do the experiments, right? Oh yeah, we can't come to your office till you turn off the router. Oh, I turned off the router. Oh, I feel so much better. We never turned off the router. Okay, right. And I did an experiment beginning of pandemic because we were locked together with my mom and my brother and sister. I took 3 drops of my blood. I put one on the router. I put one on the router in tinfoil. I put one in the other room. And 24 hours later, I looked at all 3 samples, and they looked exactly the same. That's weird. I would expect even being near some electricity, there'd be a change, right? Well, I did the same with my mom. Her blood definitely looked different. Well, I'm different than my mom. She's twice as old as I am. She doesn't do her qigong every day. She doesn't do a shot of seawater and the barefoot shoes, and I'm healthy. My biofield is very strong. So the stronger we work on ourselves, the more impervious you are to what's going on out there. You can't hide from these things. You got to feed your vibration, as cheesy as that sounds.
Mm-hmm.
So I was less affected by the router than she was.
So you're not saying it doesn't have an effect. It's just like the buildup of your own biofield, right?
Yeah, everyone's unique. And some people definitely are very EMF sensitive. They've got things going on and they can feel it. Energy is a big deal, right? For me, you'll laugh, dude, because my girlfriend, she's a PhD in biomedicine. She's a master's in engineering. She's lectured with Bruce Lipton and Joe Dispenza. She's got videos with hundreds of thousands of views. She's from Spain, so we don't know who she is, right? She worked in a nanobiotechnology laboratory also. So she goes out with her EMF device, and she's got the nice big one, not the little cheesy one. And you'll laugh, dude. The worst spot in the whole house is for electromagnetic frequency or pollution is my pillow in my bed. Literally, the whole box is right on the other side of the wall of my bedroom, right behind my pillow.
Ooh.
Yeah. So she's measuring it. It's shitty. I don't notice. Shit. Right. And we rearrange the bedroom because I'm all about that. I only have this body for so long. And I know eventually things, I'm good. I'm strong. I'm healthy. I do my work, but that doesn't mean I'm not going to get affected as time goes on. It's stupid for me to live with my head next to that thing for a long time. So we moved the bed. Do I notice a difference? I don't know. My mom would probably notice a difference. But so yeah, everyone is unique is the deal. And, even my girlfriend Anna would say, 4 of us hike up a hill. What happens to heart rate? It's different for different people. Does that mean I caught it from you? We go through similar circumstances, things like that. So anyway, so the blood will show us a lot of interesting things, even more so. Now, these little guys, those little guys that are moving around in the blood, the symbionts, the microzymas, whatever you want to call them, okay, your activity, your chi, these things. Those little guys will morph and change and adapt into bacteria and into fungus based on our terrain. This says aerobiosis. This is called pleomorphism. All right, I have the wrong chart that doesn't say pleomorphism on there. Pleomorphism was Enderline. So these little guys, based on your terrain, will change into bacteria and fungus. Why? To help us. All right? When we talk about things like, and I think I'll show you this here. Yep. They'll do this to help us. pHs are off, things like that. In our garden, worms come and they eat certain things, and then they fertilize and they aerate the soil. All right. This is the idea of parasites. Parasites come in and they do certain things. If you got too many, that's one experience. But gardeners, farmers know when you have worms in your soil, that's a good thing. Too many is another story. So what happens with this process is, based on your terrain, all right, if something goes on in the terrain, and let's say a homotoxin, something enters the body that the body doesn't want, that's not supposed to be there, right? And this is what happens. The first thing is the body will excrete. That's normal, okay? If excretion doesn't work, then inflammation comes into the picture. That's bacterial. We're creating the bacteria inside of us, okay? It's coming from within. It's not coming outside. There have experiments been done to prove that as well. So now inflammation is here. We're trying to heal. But if the inflammation can't get out, if the bacteria can't assist in getting things out, then things have to deposit somewhere. That's deposition. And things are going to deposit wherever you're weakest. A lot of grief, things go to the lungs. A lot of anger, things go to the liver. You got scars and different surgeries, things are going to go accumulate there. Okay? This is debris that wants to get out of the body somehow. Once you get into deposition, now things are fungal. Now you're starting to mold. Okay? It deposits, then things impregnate, then they degenerate and de-differentiate. That's your breaking down. Okay? And this is homotoxicology. This is the chart right here. Get you out of the way. Top, here's excretion, inflammation, deposition, impregnation, degeneration, de-differentiation. We look at skin, the organ system. Sweating is how we get things out of the body. That's excretion, right? If that doesn't work, now we have acne. Acne is inflammation. Mm-hmm. What do? We put on acne cream because acne is gross, right? Mm-hmm. Now you just push that crap deeper. Nevi are like birthmarks. This is like it's starting to deposit somewhere. It can't get out, so it's going to put it somewhere. Next thing you know, you have allergies. Scleroderma is a skin disease, and then you get the melanomas. This whole sixth column are all the cancers. All right? If we look at the respiratory system, cough, get that crap out, or take cough syrup. Remember that stuff? Right? Why? So we don't cough that crap out and it stays in. Now you got bronchitis. Good job. Yay.
Yeah, right.
So we got something for that too. Keep it even deeper. Now we got smoker's lung. Then we got chronic bronchitis and emphysema and your carcinoma. Okay, this is the patterns and progression of disease. People should learn about this. And it works from top left to bottom right. It says down here at the bottom, the 6-phase table is a field matrix reflecting medical experience based on careful observation and empirical learning. It's a phase-by-phase arrangement of disorders with no direct relationship between them. So what this means is they can't trace patterns, all right? Something comes into the body and you got grief, then you get the lung issues. You got anger, it's going to go to the liver, all right? Different things, different places. So this can start with sweating and acne, and then all of a sudden you can come down to heart disease. And now you got heart failure, all right? And as my dad treated people, if you're down in this area, you got a thyroid cancer, you would start to go back the way you came. So the symptoms start to resurface. We just pushed everything deeper and deeper and deeper and deeper till you're literally falling apart. Differentiation is when cells become, first you have the stem cells, then they differentiate. They become liver cells and lung cells. De-differentiation is they're just breaking apart, falling apart. And my dad would say cancer is a natural process. It should happen when you're in the ground. So people are literally decomposing, molding while they're alive. Mm-hmm. All right? Let's keep going. So once again, blocks in the body will create symptoms. The symptoms, you can definitely look at this chart and see where they're at. And then we'll give you all kinds of pharmaceuticals for this. In the United States, the average American's on 3 to 5 pharmaceuticals. And they say 1 in 3 Americans is going to get cancer. Of course, if they're all on 3 to 5, one more and you're getting your cancers. Mm-hmm. All right? It's a perfect progression of disease. Now, Why do things show up? Why can't the body excrete? Because there are blocks in the body. The system is not efficient. Our body is the perfect machine. If it's working, we deal with all kinds of stuff. If it's not working efficiently, then things build up. This is where the Lyme disease at the end, the autoimmune, things are building up and building up. We look at the blood. These blocks we see can be physical blocks. All right, your body's out of alignment. Things are broken. We see bones in the blood. All right, this is my knee. Here's an air pocket, by the way, with some dirt, not COVID crystals. This is my knee. This is a picture from an anatomy book of a knee. Okay, someone fell on my knee at a Slayer concert. Loving heavy metal. Don't like Slayer so much because people get hurt at Slayer concerts. I've seen so many concerts. That's the only one I got hurt at.
So how do you know that's dirt and not something else
because
that looks like dirt?
I have looked at dirty slides. When we were taught, we look at slides without any blood on them. Okay, and then we put saline and things like that. This is an air pocket. I've looked at blood my dad did this for over 30 years. We know what we're looking at. All right, that's how I know. And you know what? I don't see this very often anymore because I have clean slides and I know how to take a good drop of blood. If you don't, you get dirty stuff like this. So I'll show you more of those too.
Okay.
But here's my knee. My knee matches the anatomy books. Here's a guy broke his hand, not that you can tell from that, but here's the hand and the blood.
Whoa.
Yeah. What the hell? Right? I'll keep going though. Here's the spine on the right side. There's the X-ray. On the left side, there's the blood. Here's air pocket. See that? You can see the vertebrae there, dude, and the cartilage.
Yeah, right.
It's not dirt. Western medicine says this is dirt. It's an artifact. All right. Let's see. Look at this one. Broken bone. Dude, this is what we see. Western medicine says it's dirt. And all of a sudden now, you have people that don't know what they're looking at some of these other things they've never seen and claiming they're things that they're not. See where I'm getting with that one? Scars. We see scars in the blood a lot. And the thing is this, though, I'll tell you, Patrick, because I know there's a question later. When we see something in the blood, how do I know what it is? Okay, well, first of all, we've got decades of experience. We have thousands, tens of thousands of these images, all right? Now, the other thing is this. If I see something in the blood that looks like your sacrum, and then the body worker works on your sacrum, well, after that, we look at the blood immediately again, the blood will change. The sacrum starts to break apart. The images start to dissipate. So I've seen images, there's the colon, right? It could be colon or spine, depending on. And then we address it with colon types of therapy, and then it changes in the blood. Like we've done this a lot, over and over and over. So it's not what I know or what I think, it's what I know from repeated experience. And like I said, some of these are easy, okay? This one, look at this. Dad saw this in the blood. He said, it looks like a dental implant. That doesn't look natural. The person said, I have a dental implant that I've been in so much pain. This is the implant. And dude, I don't know if I have this one here. They took the implant out. Nope. And the image starts to dissipate in the blood immediately. All right. And I'm not going to, dude, I can't Photoshop these things. Why? So I can lie to people and then steal their money? You're going to know. If you don't get results with what we do, that's the deal. So the difference is we haven't done research. I never published anything on Substack and all this kind of things, right? The only proof we have of what we did is that people got better and they lived, aside from the decades of images and that, right? So we see all kinds of things in the blood. Emotions. Here's your worry cells, all right? This is one of those things that, Robert Young said this was graphene. Maybe it showed up because you're worried about the injections, but that is not graphene. Not. Okay. And this was in Enderlein's book, 1920s, this book came out or something. These images I've seen for decades. All right. And then, like you said, someone could say, oh, they've been doing this to us for decades. Shut up. Is my response. They've been doing a lot of things to us for decades. Okay. But this is not what we're seeing now from this. We've seen this before. And this was before what's going on now. All right. But still, worries, emotions, we see them.
But so you don't think that could be the case, that they've been just putting this stuff in everything for a while?
It's like I said, we addressed it, we removed your worry, and this went away. Okay, what they're putting in these things are unnatural substances that just don't go away because you changed your thought process. You know what I mean? What they're putting into these things is impregnating into the tissue. We don't know what's going on with these things right now. I have someone I just worked with and blood clots in the head. And we looked at the blood, and there's a lot of structural. She needs to get the structure. She needs to get her body aligned so everything flows, but at the same time, there's a foreign substance in that body that I don't know what it's going to do. I don't know. This is something new. It's an experiment that people volunteered for. So now this, like I said, we look at this, we see something, we address it, it goes away. Right? So I know that what's going on right now with what people are going through, with what I've seen in the blood, I observed the experience for 3 months. Like I had vials, right?
Mm-hmm.
And that stuff, if you got injected with that, it doesn't just go away. There's we're working on that right now. Like I'm actually talking with doctors around the world about what do we do about that. And I got to tell you, there's a lot that are like, their response is nothing. There's nothing you can do. Enjoy your life because you don't know when it's going to end. And that sucks.
Wow. So what do you see when you're looking at a
Yeah, I'll get to that
vial?
too.
Okay. All right.
My crash course here.
Okay.
So we see emotions. These are older emotions, crystallized, they're closed. This one's actually in the shape of an organ of sorts. All right. These are the older emotions that we're not ready to deal with. When we see the colors, you got some issues. This one, top left, the blue is shock to the central nervous system. Red is irritation. The black is necrotic tissue, as we would call it. This one, top left, is end-stage liver cancer. It's actually the shape of the liver. This person died. Okay, so this is what we're seeing as far as connections with different things in the blood. This is an interesting one. Here's an inflamed appendix in the anatomy book, and here's one in the blood. This person, we saw this, and the next day their appendix burst. Right?
Wow.
Lung, look at this. And dude, these images will show up in every drop we take from you until the issue gets addressed. All right. Lung, like I said, I've got tens of thousands of images like this. Colon, look at this one. Oh, there's an air pocket. And here's some hydrogel. Lame. This one, we can actually tell this person still had to go to the bathroom. So I shit you not, dude. There it is right there. No pun
You
intended.
shit me not.
There's the poop. All from New York, so we can do this. I'm excited we can do this, yes. For your listeners,
Boston, New York.
we're going to talk about some things that we don't get to talk about typically because my mouth has been kept shut on it.
Oh, no.
More things that I'll show you. There it is again, right? Bigger picture. Kidney. Dude, look at this picture of a kidney. That's like perfect.
That's crazy.
And dude, I got this one. Dude, I love what we do. It's amazing. I still do this. I put a drop of blood. It's like, wow, what's that? These things show up, dude. They're there for a reason. Look at this picture. This is
what you mean when you say the holographic blood. It's like it's like projecting.
Yes. And here's the thing. The way this works, all matter vibrates at different frequencies. We know this. Iron, aluminum, steel, these things, right? Molecules at different speeds. Same with us. Tissues, different frequencies. If everything is awesome, it's like this beautiful symphony we have in the body. Everything is just good. If something is out of balance, it changes the frequency, creates a disturbance field, an interference field. And that's what we're seeing. The way holograms are made, I used to have an image. I'm not the physics guy, but to make a holographic image, you split a beam and you're basically taking a picture of an interference field. So there's an interference field in the blood, in the body. The microscope we have splits the light, doesn't go straight through the slide. That's the dark field experience. So we're seeing things visually. We're seeing imbalance in the body, in the blood, as the blood leaves the body. Now, I'll tell you this. This is another reason these people are wrong. We take a drop of blood from your finger, capillary blood. Capillary is only big enough for one red cell to fit through at a time. If this image was physically in your bloodstream, you could have a stroke. This could be a problem for you.
Wow.
So all these images that I show you, they're bigger than red cells. All right, look how small the red cells are here. Look how small the red cells are here. The lungs they're big in the body, and they show up big in the blood too. Look at the kidney. Look how much bigger the red cells are. Either way, these images are huge compared to your cells. So what these people are telling you as far as hydrogel and other things, they are wrong. These are holograms. They don't know that. Okay? So that's one reason not to listen to them. Would you listen to people that just talk about things they don't know and make up stuff? I'd rather not.
So let me ask you this. So if somebody told me like you got injected with this thing and now you have microchips in your blood, would my blood manifest microchips?
If there was something foreign, dude, I just showed you an implant, a dental implant. We've seen prosthetic knees. We've seen pacemakers. If there was something in your body that your body was foreign to your body that your body didn't want to deal with, we would see it, definitely. Okay?
But I'm saying, like, can you manifest an image if you're worrying about it?
Oh, I don't know. That's a good question. You can manifest an injury. You can manifest an illness and a sickness, most definitely.
Right.
That's a good question. I'm not sure. Potentially. I'll tell you this. The image of the broken femur that you saw, this is a weird one. That image we got as a distance consultation. We send out slide kits. You stick your finger, blood on the slide, get it back to us within 24 hours. We can see what we need to see. So this one was a slide kit from the mail. Dad looked at it and said broken bone. There's no bone in history, but people forget these things also in their histories. Oh, I forgot I had my leg amputated. Is that a surgery? So Dad says to the woman, broken bone? Nope, no broken bone. Dad's like, that's weird, because this is a very specific picture, you know. So no broken bone. Why is this showing up like this? A week later, he's still concerned. He says, call her up again. No, someone calls her. No, no broken bone. We do this a few times. Finally, you know, the woman says, stop calling me. Stop harassing me. Well, a month later, we got a call. Guess who broke a bone? Yeah. This is the law of attraction, the accident waiting to happen. Be careful what you think, because you bring shit on, right? Yeah, the person was the grandma. She was taking care of the grandchildren and the children. She was tired. She wanted to be taking care of herself. So this is what she thinks. I don't want to do this. I want to be taken care of. She broke a bone. Guess who had to be taken care of? Right? So, yeah, I think that kind of answers your question. We can in a way, but I haven't seen it. You know, I see a lot of people that are afraid right now, and I haven't seen microchips out of fear. No. I have a woman that just came to me. She was afraid after they let people out of their home. She stayed home for another year because she was so afraid.
Yeah, I've met people like that. Yeah.
Yep.
But I asked that because, I mean, it's just strange. Like, you can't deny that there's a big agenda, it seems like, this transhumanist thing.
Not denying that at all. Yes.
Right. And there's, you know, documentation that really supports, you know, people like Mahalcha's work and Robert O. Young. It seems like this is going on.
Not their microscope work, but their others.
Right.
Yes. Go ahead.
Well, their theory or whatever they're trying to purport.
I support that.
So I wonder if, you know, a lot of that stuff is just to instill fear and manifest these things.
Yeah, well, potentially there's controlled opposition, that whole experience, you know, and I like to think that these people, they're not trying to do the wrong thing. They're trying to help people. They just don't know what they're talking about. You know, it's like your Western medicine doctor. He's trying to help people. He just doesn't know that what he does isn't helping when he's giving antibiotics. I mean, antibiotics can help at certain times, but that's anti-life. You know, so, and like I said, they haven't found the cause or cure of one chronic disease in over 100 years. My dad has. You know, why isn't he famous? Because they don't want him to be famous. Dude, I mean, I know people, Don Lester and David Parker wrote the book, What Really Makes You Ill. They researched for 10 years, never found my dad. He's not, you know, we were not the easiest to find, depending on, but when you find us, we're pretty solid. And yes, the agenda, that whole experience, look, dude, they've been controlling us forever, for years. You know, and they don't have our best interest at heart. We know this. You know, why would the AMA, you know, bring my dad up on charges of killing someone illegally? Don't you think they'd be excited that he helped somebody? Right? So they're not interested in helping you. There's definitely, I support, there's definitely a control thing going on. Definitely. Schooling and all that crap too, right? Best thing you can do is keep your kids out of public school. A couple more images and then we'll chat a little more here too. Nervous system. So look, there's the nervous system. There it is in the blood. I don't make these things up. You know, this one's fun. This person, she worked with us, Fiona. She's awesome. She still works with us. She was a client. She fell on, hit her head while ice skating. There's her head. There's her neck. She went to the hospital. She came to us afterwards. We looked at her blood. We said, we think you're hemorrhaging. And we sent her back to the hospital. And they said, oh, yeah, you are hemorrhaging. So all their technology and all their tests and all their crap, and they didn't see this. And we did with one drop of blood. That could have been a problem for her, right? Let me see what else I put up here. Here's the sonogram on the top. And there's the baby in the blood. We used to tell people if it was going to be a boy or a girl. This woman was 6 months pregnant. You can see the umbilical cord too, right? So we see interesting things. We see the blood change before and after. Huge changes that are awesome, all right? That one I won't talk about right now. Let me see. There was a couple other ones. No, there's Dad's book. No, I think that's about it for the presentation experience. I do have a ton of other things I can show you depending on the conversation at this point in time. So,
Yeah, I mean,
uh,
I want to. Are we able to see what's in like a Pfizer vial and see what you see? What are you finding that is concerning, and like we can identify?
all right, let me see what I got here. I have so many different things. Let's see what I can find. I looked up ahead of time and I had prepared a couple things. Not that I remember where it is. This one, no, this was one I did with Steve Falconer. Here's an interesting image. Wonder what that is.
Oh,
Yep, vasectomy, right? We see
never
all
seen a
kinds of.
schlong in blood before.
Yep, now you have. Isn't it great when you have me on do things like this?
Yeah, first time for everything.
Yes, I can show you these in a moment, but let me see here. I had blood newest. Where is it? Bubbles. I got bubbles. No, those are just bubbles. Blood. Yes, hold on. Give me one moment. I tried to be prepared. Health loop, health 2. Where's the NZ ones? This one here, NZ response. No, that's pretty funny. Okay, so I don't know where my video is. That's funny. I'll pull it up over here in a second. I sent you. Did I send you a couple links so you could see a couple of the things I had, didn't you?
I watched the videos you sent me. I think that's all you sent me. You sent me like a really short video and then a little bit of a longer one.
Yeah.
They weren't.
Okay, here we go. So this is one of the first things that went on. This is just pure.
Okay.
That's all biological material, and I don't know what the hell that thing is in the middle. All right.
Okay.
But I know it's bigger than red cells. Okay. I think that was maybe one of the videos I showed you. Let me pull this one up. So yeah, we investigated. Initially, I was approached by a well-known organization who said, "Can you look at this for me?" And I said, "Sure." I said, "I got to tell you, all I know is blood." So there's that, which was fine. And hold on a second, I'll pull this one up. Here we go. I said, "All I know is blood," and they said, "That's fine. You have a different perspective, which is nice." So I said, "Okay." We looked at things and we saw some things. And then we actually, my girlfriend's a scientist, so we were able to figure some things out, which was kind of interesting.
Mm-hmm.
Let me see if I get this one full screen. There we go. All right. So this was, one of the earlier investigations we did. And I observed over the course of 3 months, several different vials of the same batch. Okay. So this is, I don't know what these metallic looking things are at all. Like I said, we did an investigation, I think the one I showed you, where we took a drop of blood and added this to the blood. So initially I didn't look at someone that had been injected with this. But I have a sample of this that 2 months later still had this much activity going on. So it's very resilient, whatever this stuff is. Okay. It's reflective. So, I don't know what it is.
Could it be nanotech?
Good question. No, because nano is 1,000 times smaller than micro, I just learned this, which is why we call it a microscope, because we see micro,
right?
Not nano. Okay. So no, if it is, I cannot see it with my microscope.
Okay. So then doesn't that kind of make the conversation a little bit moot because
Totally.
nobody can see on that level?
Yeah. Besides the fact, like I said, dude, none of these people have ever worked in a nanobiotechnology laboratory. My girlfriend did. She's seen these things. Graphene is a drug delivery system. It's been put in tons of things. Graphene is in my wetsuit. Okay.
Okay.
It's like fecal matter. They say there's fecal matter on your toothbrush right now. It's everywhere. That doesn't mean they're putting it in this, although the things they put in these substances, they were forbidden to put in the substances in the first place.
Yeah.
So here's a poison. They put stuff in they weren't allowed to put in. And it's funny because in my mind, it's like, well, there's gasoline and blowfish venom and arsenic. And like let's name 5 poisons and then some other things. And people are going, what other things? It's like, who cares? All those other things are going to kill you anyways. So if you didn't do this, good for you. If you did, good luck, maybe. I don't know. We're working. We're seeing what we can do. But yes, right there, Patrick. Nano cannot be seen. 1,000 times smaller than micro. So shut up. Well,
I think that's a big deal, though, right? Because you're right. Like these people probably aren't seeing what they're saying they're seeing, but nobody really friggin' knows at the same time. There very well could be stuff going on.
I'm sure there is. Okay, look at this stuff, dude. You inject this into your body. Here's a drop of blood that we put it in. We put the substance in the blood. So this wasn't from somebody, okay? But these things moving around, like look at this. This is bigger than a red cell. And I just told you that, well, capillaries are the same size as a red cell. Could this clog something? Can this create a blood clot? Duh. Yes, it can, without question. Okay? So yes, nano, that is, there are three different things I think that just end the conversation. You know, when I say I've seen these before and I know what they are, they don't. You know, well, okay, then just stop it. All right. And it was funny because what was it? You can't see nano, right? These are things I've seen for decades. It's
Okay.
capillary blood, so physically that can't be in there in the first place. They're saying hydrogel, you know, and the thing is, hydrogel is a gel. When you put it in the body, it doesn't just sit there like it came out of toothpaste. It disperses.
Right. Would think. Yeah.
Yeah, these people have no idea what they're talking about. And like I said, I'm not here to attack messengers. They're trying to do something to help people. All right. And I do believe that agenda experience, but they are wrong with their imagery. So,
Okay.
and I have a problem with this. Okay. This is one of these things people say, well, more people are saying that than what you're saying. I am the only one in the world right now saying this. Okay.
Mhm.
But I got to tell you, I know a lot of live blood and analysis people that don't agree with what they're saying either. Like I have a woman right now, 10 years working with cancer in a microscope. She took a live blood course and she said, this doesn't make sense to me. And she found us and she said, you guys make sense. Yeah,
Mm.
we know what we're talking about. We've done this for a long time. And tell me, Patrick, if you found something revolutionary, what would you do? Would you go, oh my God, look at me. Look at me. Look, I know everything. Or would you try to search out people that have had some experience with this to find what they think, get their input,
Yeah, for
right?
sure. Yeah.
My question is, how is it going to feel to these people when they realize they're wrong? That sucks, dude. And I got to tell you, I know someone I think whose friend may be dead from overchelation due to recommendations from people that don't know what they're talking about. Okay. And even so I had one person yell at me and say, well, more people are saying this than you. And I said, yeah, and even more people are saying get validated than this.
Mm.
So this is a bandwagon fallacy, learning about fallacies. So shut up. She didn't like that, right? This is funny because this is the last spot of this little video. The thing I could find that was closest to the substances was kitchen cleaner. And I think I said this to you. I would feel safer injecting myself with kitchen cleaner than I would with this stuff, right? Wow.
Mm.
So, and I have videos of us. I have one video of us showing us taking it out of the sample with 2 cameras. Like we did this with as much integrity as possible so you can see everything we do. And I was approached by people like Shimon Rabinowitz, who worked with Anna Nahasea and David Nixon. And I refused to let him use my images. I wanted to have him sign a non-disclosure. And his response was, why? It's like, so you don't use my images and lie
Mm.
and say things you don't know what you're talking about. Okay? So, yeah, this has been difficult. You know, and the picture is, dude, we're just here trying to do our thing. That's it. You know, and out of left field comes this person who's like, the big grin on their face of, I'm saving the world. I know everything. And there's this image. I know exactly what that is. And then I have people that are arguing with me, you know, so I haven't said very much. All right. And part of the story at this point too is funny because I have a training course we're doing. And it's funny too, because I don't have a lot of money. I have no secretary. I have no marketing people. I know people that can't unsubscribe to Anna Nahasea's emails. They can't unsubscribe, right? And my poor senior friends are freaking out. These old people are petrified, you know. And the thing is, psychologically, we need to see something 3 to 5 times before we start to believe and see it, right? So I don't email anybody anything, all right? I don't publish anything. I'm working with people. I'm doing webinars and interviews and things, but I don't have the energy, the capacity, the resources. I don't have any funding. I have microscopes that are out of production. And if mine breaks, I don't have another one. These people have so much more going for them. And here we are, struggling, helping people, quietly doing our work. And the next thing you know, pandemic, and it's like, wow, this is ridiculous. This is so dumb. I got a local guy that tells people my dad was deranged. Okay. And this guy is teaching people in 4 days to do live blood analysis and IV ozone. Someone's going to die. Someone's going to inject a bubble. Like someone's going to have a problem. And recently, I know people that work with David Nixon, and they won't say anything to him. They're afraid. Okay, this guy has been looking at the blood for 2 years, and he says, "I encourage everyone to get a microscope and send me your images." I don't. I mean, how dare you get a microscope, take a 4-day course, and start telling people you know what you're talking about? And this is not a joke. This is a responsibility. You can hurt people with this information, and you're scaring the crap out of people.
Yeah.
And they're getting unnecessary treatments. So now we just developed a training course, just the blood basics. If you want to take that, you have to take at least my 13-week course first. And I might teach you that course. I think at this point, Josh and I are going to do, we have 2 courses. I think you have to take 26 weeks worth of our courses, and then we'll teach you the basics. And then we'll consult with you, and we'll work with you and support you. You know, my brother's funny because he doesn't want us teaching this work because people do stupid crap with it. You know, and we developed this blood basics. I said, let's teach it to everybody. Right now, live blood is hot. Darkfield's hot. I can capitalize on this. I can make some money. But I had people that knew my dad. I had well-educated people that reached out and said, don't you dare share this information with those people. We need to qualify people. I need to know I can trust you. We have taught some people, but I don't trust any of them at all. You know, so right now, it's a strange spot. I don't want to do this. I don't want to talk bad about anybody and about what they do, you know? And it's funny because I'm trying to promote my training course, which started last week. It's a terrain course. It's not a blood course. We use the blood to teach, but we don't teach people how to do the blood. And I don't know how to market. I suck at that. Really, wow.
Same. Yeah.
Dude, we got great webinars. I got famous people that come to our webinars, you know, and other people are like, oh my God, why don't you have more followers, you know, and more people? It's like, I don't know how to do that. Maybe we're shadow banned, you know, my brother posts things. I don't know. So right now, we're just trying to do our thing. We're trying to develop microscopes that we can use because the older technology doesn't work for us. And every week, it seems like somebody sends me these damn images. I wrote a song, you know. Did I send you my song? Stop sending me microscope images because they're dumb. You know, as a microscopist, one that has had more experience than most people in the entire world with the dark field, my perspective is don't listen to anybody that's sharing microscope images and telling you things right now. At all. The electron microscope images, dude, you can't do chemical analysis from a picture. Impossible. There's one microscope that will do it. $150,000, right? Anyone wants to buy it for me or buy it, just let me use it. We'll see what we can do. I know the rep told us that Pfizer has one and Moderna has one, right? You want to know what's in those things? Someone out there buy us a microscope for $150,000. Probably take us a year or so to get our chemical analysis going and really figure something out. In the meantime, people are going to keep dying. I'm just going to focus on how to help people at this point, right? That's my deal. But Kaufman's talked about it. We'll never know what's in with the inconsistency of the batches. And if you look at who's paying attention to these things, right? Who are the people that I listen to or that we listen to that we know of? They're not talking about this. Okay, Kaufman doesn't talk about graphene and hydrogel. Why? Because there's no reason to talk about it right now. There's no proof. Okay? There is no proof. That's it. So even from the very beginning, we know more than anybody. My girlfriend knows the guy that gave the first vial to Dr. Pablo Campra, who wrote the first graphene paper, who bought a microscope after meeting me. Okay? He wrote, there may or may not be. Ricardo from Quinta Columna took it and ran with it. Said there may be. You hear what you want to hear. And eventually things have changed, and Campra says, yeah, there is. But we can't tell that for sure. There is no way, not with my microscope, not with an electron microscope. Kaufman said it. We need a team of researchers doing chemical analysis and all kinds of things, and we'll probably still never know. So at this point, the best thing you can do is not put it in your body, learn how your body works. And the simplest experience with health is sympathetic or parasympathetic. You're either in fight or flight or rest and recuperate. So when you're afraid, you do not heal. Right? This to me is part of the experience. If they can keep us in fear, great. We're going to get sick.
Yeah.
It's easy.
I've always felt like there was something off about this. I mean, I think it's so, and with everything, it's so multi-layered that we really don't know, but it's important, yeah, to hear your perspective because I think it's a big clue as to what may be really going on. I think like, you know, the rest is hidden in the nature of the blood. possibly. And I think this holographic thing will be a big point for me to kind of look into, because I mean, I study a lot of occult science and all that. I love Steiner. I mean, he said stuff like, the blood was dwelling place of entities from higher worlds, and
Yeah.
I mean, so much is made out of the blood, and just it's an important fluid, right?
It's sacred.
Yeah, it really is. And I think there is something going on. I think they did probably do something, but what is being represented is probably not that thing.
Right. That's my thing at this point, Patrick, is
Yeah.
I'm not saying that they're not doing what they're doing. What I'm saying
Hmm.
is the people with the microscopes don't know what they're talking about. Okay, the people
Okay.
with the microscopes, what they're saying, they're seeing is not that. Okay, so that's it. And I think at this point, I asked the senior group once, I said, wouldn't it be nice if you didn't have to worry about hydrogel and graphene? And they said, yeah. And I said, so stop it. Stop it. All right, first of
Yeah.
all, if you didn't take the substance, good for you. All right, you can't avoid whatever's going on in the environment. The best thing you can do is strengthen your terrain. All right, for people that are afraid of chemtrails, and my experience with chemtrails was initially they're putting things in the atmosphere so there's no radar can detect and spy on us, right? Sounds great to me. Well, either way, there's stuff in the environment, the atmosphere, that we have to be inhaling, right? So what
Hmm.
do? You can't put on your tinfoil hat and hide from it, all right?
Yeah.
One of the best things you can do is get the hell outside and expose yourself to it. Be healthy. Let your body learn how to deal with this and adapt. You can't. I'm one of the only people that says this. And am I crazy? Well, I'm not normal. That's for sure, right?
No,
Crazy
you're
is
right.
normal. Normal's crazy. Go ahead.
Yeah, the first thing I tell everybody is, like, fear is not going to help you, even if we know all these things are everywhere. The food is poison, the air is, they're spraying things, whatever they're doing. Fear is never going to help you. Don't, like, being in your head about it, and because I know so many people who are, who are like worrying about everything, like, oh, EMF and all this stuff, and my phone, and
Dude,
I just try to do
be
what I can
conscious.
do. Yeah,
Yeah.
just be conscious, do my best, right?
Yeah.
And as long as I stand with God, I'm taken care of. Like, that's all I can say,
Well, and
right?
I'll go this spiritually too. For me, I appreciate the soul that came in to sacrifice itself so others could elevate. You know what I mean? So there's different places we can go to with this. But you're right. The reality is this. My day, it's beautiful outside. Okay? There's no future, there's no past, there's only right now. People that live to be over 100 don't go for regular checkups. They live in the moment. All right? So right now, and health, it's joy is so important to us. Joy is good for our pH. Joy is one of the best things. If I feed my vibration, then I'm more impervious to outside influences.
Yeah.
That's a big deal. It's energetically, physically, emotionally, spiritually. This sounds like wooey wooey, right? My girlfriend, a research scientist, at the end of one of her interviews, the guy says, what do we do in the midst of all this time? She says, take off your shoes, take off your mask, go outside and hug a tree. Not romantically, but getting the negative ions. Okay, that's important. Grounding is a scientific experience that has to do with the electrical experience, and this is very solid. Get outside and ground. Get out into nature and get some damn joy. It's the best thing you can do. It was the Shawshank Redemption. Get busy living or get busy dying.
Yeah, for sure.
Honestly, dude, get up and don't scan yourself to see what's wrong. There's always something wrong. Get up and get some damn joy in your day. And if we can get together, we entrain. Okay, did you ever see those videos with the metronomes where they line up?
Yeah.
Yes. So I'm convinced that if we did the scale on those, there's one where it has 3 metronomes. They take the one in the middle away, and the other 2 get weird, and put the one in the middle back. I'm convinced if we do the scale, and we do it to human scale, it's 6 feet. All right? They don't want us getting together. When we get together, we're powerful. Me as you can hear my energy. You can feel my energy. I love what I do. I love my life, good, bad, and ugly. It's a part of the experience. So then when I get together with other people like you, we have a good time. Our vibration increases. Then together, we're more impervious. The best thing we can do is gather with like-minded people and share joy. Dude, concerts? I would love to do that experiment somehow visually to have a concert and I don't know if we could see it with infrared or something and measure the energy and then bombard it with 5G, and watch how resistant it is. to that.
Yeah.
I mean, it really is, dude. This is people right now are stuck in negativity. Misha Kobayashi says from the Emoto Peace Project, she says we have 60 to 80,000 emotions a day, and 80% of them are negative. Actually, more now. There's so much negativity and fear and confusion everywhere, even from these people that are trying to help, right?
Yeah.
It's creating chaos. So
Yeah.
what do? Forget all that crap. That's so funny. Nina just wrote a song. Forget all that crap. Writing songs about this now, too. Totally. Forget that crap. All right, get up, have a good damn breakfast, call your mom, call a friend, read a book, take a bike ride, do your thing. But you got to support the body physically, energetically, emotionally, and spiritually every day, because life is going to hit you physically, energetically, emotionally, and spiritually every day.
Yeah.
And when you're down, you get hit even harder, right?
Mm-hmm.
If life is a game, we need to get pumped up before we get on the field. So the reality is we have so much power within us. I talked to Nick Begich once. Nick Begich, famous. He wrote the book Angels Don't Play This Harp. He uncovered the harp device where they were controlling the weather. Okay.
Yeah.
Nick Begich's dad was a politician that helped get Nixon busted. And Nick Begich's dad disappeared mysteriously in a plane. They never found his body. Chills, right?
Wow.
This is real stuff. So Nick Begich says to me, he says, yes, Adam, the military is messing with the weather. For your benefit or not, that's another story. He said, but the military has been studying the power of the individual for a long time, and it scares them. Yeah. Okay. He said, I get chills again, which is a connection with an electrical connection with the truth, I was told at one point. Did you ever see the movie Men Who Stare at Goats? Was it a stupid movie with George Clooney?
I know of it, but I don't think I ever saw it.
Oh, dude, go watch it again.
Yeah.
Yes. Nick Begich said, there's truth out there in certain movies. He said, if you've seen that movie, he said, watch it again. He said, there's more in that movie is true than you would think. And I watched it a second time. The first thing that comes up on the screen is a sentence that says, more in this movie is true than you would think.
Yeah.
It chills, dude. So that's it, dude. We have so much power. We have the power to create disease within us. We have the power to be healthy. All right. Where do we put our attention? Where do we put our focus? Do we put it on fear and confusion and inconsistency? Do we remove some inconsistencies and see what's consistent? That's all we ever did. This is the Sherlock Holmes thing. My dad looked for consistencies and removed things that were not consistent, and we were left with a truth. The blood is holographic. I can see things in your blood, and I can tell you what's going on with you. I don't diagnose because that's a label, and we don't believe in that. Mm-hmm. But I can see all kinds of things in your blood. And
if you tell the average doctor, oh, the blood is holographic, they'll probably tell you you're a lunatic. They'll make fun of you, right?
Doctors have spent hundreds of thousands of dollars and years for their education. It's very valuable to them. And dude, I know that you can create a new habit in 21 days. I can brainwash you in less than that. Now think of 7 years of brainwashing. Okay. My dad's stories, he said, first day of medical school, they wrote homeopathy on the board and acupuncture and all these things and talked about how stupid it was and made fun of those things. Right. And what they taught my dad was that he was a god, that he knows and no one else does. And your patients are going to ask you and they don't know. They're dumb. We have a friend whose real doctor only allows her 3 questions a visit. Because how dare you question him? He's the expert. Dude, you can question us all we want. Our job is to educate you so you understand.
I had a doctor, he wanted to do surgery on me because I had a deviated septum, really bad. And he wanted to go up past my eyes, whatever. And I'm like, so can you tell me, exactly what this process entails and why why you feel like you need to do this, whatever. He just literally stared at me like, how dare you ask me that? Yeah. How dare you question my methods?
Yes, right.
And I
you can fire your doctor. You can fire him. He works for you. Right?
Oh, I never went back to him. I still haven't had the surgery. I'm like, I'll just breathe poorly for the rest of my life.
Dude, this is just what they've been taught. Okay, I have a friend here, a student, and she goes for routine tests. They tell her hormone levels are a little low. So they think she has a tumor on her pituitary. They'd like to crack her skull open. Oof. She says, can't you do a scan first? They said, yeah. Dude, come on. Right?
Yeah, maybe.
Dude, and I look at her blood. Okay, I see lots of pressure at thyroid, which has to do with hormones. Right? I consider the body worker, aligns the body, takes pressure off, get her a test again. I bet those numbers change. And she didn't have to do a surgery. This is the thing too, Patrick. It's like I said, I like people, I feel for doctors. They went in to do something to help people, and they didn't realize they were taught wrong. And then they're not allowed to question. They don't even know how to think about these things. They don't know how to read the studies. And then the insurance companies will drop you if you don't prescribe enough, pharmaceuticals. So there's really nothing that a doctor can do. I've done training courses, and the MDs are the hardest to work with because it's like there's real cognitive dissonance. I had an MD in one of our courses crying. She was like, she's like, you need to stop. I was like, what? She's like, you're blowing my mind. She said, everything you're talking about, I have seen, but that's not what I was told. She said, I saw this when it was this, and you said it was that, and then this and this. She's like, you're overwhelming me. I think my life has been a lie. Didn't Lanka just say this with, Stefan Lanka with his whole virology experience, right? My life is a lie. Virology is a lie. So this woman was having a hard time. I get it. I'll tell you this. Here's another weird one. We had an MD at one point. You go see MDs, they take your blood, send it to the lab, get results. So there was an MD that was working with us, and she would send the blood to us. We'd do the consultation, and then she'd work with her patients. She was getting it. There are a lot of MDs now that are starting, they know something went wrong, and they don't know what to do about it. They're not allowed to talk about it. I mean, I've got people all over the world that are trying to come to us to say, how do we learn? What do we do? And we're putting together some things to deal with these people to help as much as we can. But they can't fight the system. There's no way. It's a big system, and they'll smack the crap out of you. When my dad gave up his medical license, he said he was finally free. He wasn't under their jurisdiction, right? Yeah. And then even I had someone say, well, you don't have MD behind your name. It's like, yeah, and all the MDs, they're telling you to get vaccinated. So what the hell? Just because I don't have letters behind my name. I feel for people. I love what we do. Health is simple. People are complicated. And we make it way more complicated than we need to. And this is something my dad said. And it's amazing, dude, how many consultations we do and how similar the issues can be. All right. And how even two people can go through two totally different things because of the same experience. Their body's out of alignment, but they're putting pressure on different places. They've got scars, but they're in different places. They have thoughts, that they can't deal with because there's confusion there. They don't understand. Everyone in my family died of cancer. I'm going to die of cancer. Oh my God. Until you learn about it, and then you change what goes on in your head. We can be healthy. We really, like Nick Begich said, the military is studying the power of the individual, and it scares them. Yeah. So we need to feel good about what's going on. Change is important. All right. I would love to live in a world with less stupid people. And well, the irony is they're lining up to get shot. Unfortunately, I know some of them, their extended family and friends. And it hasn't been easy. And in the midst of the couple of years, or 2 or 3 years, then I get these people with microscope images. Like, dude, in my world, I don't want to watch the news. I know what's going on. When if we need to know, we find out. I just want to work with people and support them with their health. I want to educate and empower anyone who comes to me to learn. I'd like to do it with the whole world, but not everyone's interested in what I have to say. Mm-hmm. Now, as I'm trying to just keep my head down and keep up on my emails and, holes in my system and market my little courses so I can make a few dollars to live in Mexico, then all these people keep sending me these damn images, And people, the video I sent you, I think the one I did for Amanda Vollmer, awesome. People send her stuff. And what's nice is people like her send it to me. I educate them, and then she tells their people, don't listen to this. Mm-hmm. But there's nothing out there. I had people email me saying, can you please say something about this? And I've wanted to. I don't know how. I appreciate, you and I had a conversation prior to this because I'm hesitant to say these things. My brother, I will post things on Facebook. My brother will delete. He censors me. I have TMJ because my brother won't allow me to speak, which is why I'm doing this with you without my brother.
Yeah, no, I appreciate getting another perspective on this whole thing because I honestly like coming out of the podcast with Mihalcha and even Robert O. Young. I'm not saying anything bad about anybody, but I feel responsible for the information that I put out, and I always tell people, wait for more information. Yeah. Wait for more information. Don't jump on any protocols. There's always more to learn. And if you watch my podcast, I change. the perspective changes a bit.
You can evolve.
Yes, and I'm even changing, honestly, and it may be not popular to say, but I've changed my mind a little bit on the whole sort of terrain movement. Not that I think terrain is invalid, but I think at the end of the day, the most important thing is like the spiritual sciences. And the thing that we missed out of all of this is discovering that the spirit and soul is behind all of this, right? And it's sort of, it hyper focused everybody on the material.
Yes.
On like, and then you can't have a conversation about anything like, oh, this doesn't exist and this isn't happening. We don't know what's happening, so nothing's happening, and the conversation ends.
Yeah.
I friggin' hate that. I can't take it. And I think, that there is maybe a subtle form of transfer between people even. I think so.
There's entrainment. There's entrainment that goes on. Those are the conversations my girlfriend can get deeper into with you, because there's specific things in certain circumstances. The way we look at it is we have all the ingredients for everything. It's just like the farmers, okay? There was a guy, Alan Williams is a regenerative farmer. And there was a guy that regenerated 20 or 30,000 acres in Mexico, in the desert, the Chihuahuan desert. And all they did was reintroduce livestock. Okay, but what happened was, as they introduced the livestock, which did what nature does, all the indigenous flora and fauna came back. All the things they thought were extinct. Okay, it was there the whole time. It just needed the right microbiology, the right circumstances. It's the same with us, with the DNA. We have all the ingredients for everything. It depends on the circumstances, the environment, what we're doing with the physical, the energetic, the emotional, and the spiritual. All of it. And the terrain for me is not a theory. The terrain is all. And these are the laws of nature. Okay. Mm-hmm. This guy with the farm, he saw this. All those things were there. And it was interesting because he gets 30% more rain than his neighbor. So when you hear controlling the weather, we can do that too. Okay. If we support nature, then things are different. We're a part of it. That's what we talk about with the terrain. We are not separate from everything. And I asked this question to the kids when I taught that health unit. What is not a part of the terrain? There is nothing. The terrain is all. This microphone, my phone, my attitude, my guitar, you and I, we're all a part of this. And we affect it, and we're affected by it.
Yeah. We're the microcosm of the macrocosm, right?
Yes, we are. Yeah. Big time. I have pictures of blood and universes next to each other. It's the same damn thing. Right?
That's awesome.
As above, so below, dude. And it really is that. What we can do with our mind is amazing. And miracles, things that people don't believe. I see kids read with blindfolds all the time. So, well, what the hell? I thought we need our eyes to read. No, we don't. I have seen otherwise. So as soon as I can believe we don't need our eyes to read, I can believe all kinds of things. But I'm not going down a rabbit hole of fear with my beliefs, because that's not good for my health.
Right.
Right. Fear is a part of our life. And you know what I do? I love scary movies. That gets my fear fix. They're just movies, right? There's a lot of horror in the world these days, but I got to tell you too, for every action, there's equal and opposite reaction. And I see, for all the crap we've seen over the last 3 years, I have seen the opposite of that. Bridges are being made. I mean, I have made connections with people around the world. There are awesome things happening right now. And whatever they're going to do, they're going to do. Okay? The question is, what do we do? We're not fighting this whole big system. We do our thing. We can do whatever we want to do in our own little terrain experience. And for me, I moved to Mexico. Cost of living is a quarter of the cost it was in the States. I have so much less stress. And you'll love this. There's a website I found. Mexico has some of the lowest cancer rates in the world. And I think U.S. is number one, dude. So there's a line in the sand, and everyone's sick over there, but not here. What's the difference? There's a lot.
I think there's a reason, man, that they're building a wall, separating us from Mexico. And I don't think it's to keep people from coming in.
No, that's what's the irony of all this, dude, is this is how the universe works. You're going to build a wall so the Mexicans can't go to the States, which is going to be better for the Mexicans because they're going to live happier and healthier and longer in Mexico. And then any, diseased Americans can't come down and spread their fear, which is the most contagious thing there is. Fear and stupidity, I think, are contagious,
But that's how they operate, man. Those are the dialectics that get created. You got people arguing about the wall or no wall, and the immigrants or no immigrants. But meanwhile, they're just freaking keeping you in. They're trapping you in. Nobody's
and you're focused on crap. You're not focused on living your life.
Yeah.
being healthy. And that's it, dude. When people ask, like, I'll be on with Renette Senum coming up. She's running for governor of California. We'll be on with Alex Zek talking about this as well, because he invited Anna Milhab, whatever you want to pronounce her last name, to End of COVID, which we almost didn't participate in End of COVID because she was there.
Yeah.
And it's a contradiction for us. But that's it, dude. They don't need to put stuff in these injections to control us. They've been controlling us for a long time.
Yeah. They manipulate us because we are creators, really, at the end of the day.
Yes. And
we create our own reality.
We do. And what they've done as far as pitting us against each other and stuff, it's brilliant.
Yep. Yeah.
We don't have to do that. We don't have to. And I've seen things recently that are awesome, with people from, Israel and other places together. And I'm not blaming anybody, as I'm Jewish. I found out it's not my fault. Yay. Which is a good thing, right? But I've seen people coming together from all walks of life. What's gone on over the past 3 years has done more to bring people together than anything has ever done before.
I think it's also a separation, like people who need to get together are getting together, and it's like a timeline thing.
Dude,
I think
great. It's great. You want to find your tribe, well, who's not wearing a mask? You know what I mean? It's like in this days, they made it real easy for us, well, not that person, so that's easy, and I'm not here. There was a local group that was, the seniors were petrified. There's so much fear, and some of them they're afraid at certain points. Some of them are, afraid way more, and they wanted to expand the group to people that had been, and half the group left. The thing is this, even, there are people that had done this experiment and, well, it was a mistake and they realized, and I'm not here to exclude them. If I can do something to help people, I want to. Like I said, someone just came to me, blood clot in the brain, and I look at the blood. This is how conscious and focused I am. We don't look at the history form first because it'll influence us as far as what we see in the blood. My brother's the blood guy. He does the blood. I'm a technician. I take the pictures. I get them to him. I'm trying to learn it. I know some of it, definitely. Excuse me. I don't know what he knows. He worked with my dad for a long time, side by side. So I look at the blood, I see the blocks, and it makes sense as to why this person could have something impeding the flow, because she has some blocks in the body. She needs to be opened up physically. Right? And then my brother goes, "Oh, did you look at the history form?" I said, "No." Well, she said 2 5. And, dude, she had the stuff that I looked at. So she's lucky she's alive. Now, what do I do with this? Okay. I look at someone's blood. The body says, and I asked Josh once, I said, "What do we do?" He said, "We do the same thing we do with everybody. We look at the blocks, we open them up, and the body's more efficient, and then it can do what it needs to do." But he said, "But this is a new substance. If it impregnates into the tissue, we don't know." So now I have a woman. I looked at the blood, and it's like, yeah, you need body work, definitely. You got a lot of crunches and bangs, and your system's out of alignment, and things aren't efficient. And somehow I have to say to her, and by the way, the reason you have gotten a blood clot, besides the fact that your body needs to be aligned, is because of what you did to yourself. Now, I just had the conversation with my girlfriend. How do I say this to somebody without scaring the crap out of them? I don't know. In my mind, the reality is, she could die any day. She has things in her system that have already clogged things. And she went to the hospital. She was there for a month. They don't know why she had the aneurysm or the blood clot. They thought it was an aneurysm. They don't know why. No one knows anything, except there might be these things in your blood that are bigger than red cells that clog things.
Those friggin' glowing squares, alien squares. What the what is that?
I don't know, man. I have no idea, but I'm not putting it in my body.
Right.
And whatever that thing is, this metallic thing, doesn't, exude through my pores and get into you. Kaufman talks about that. But yeah, at this point, we are now in this spot. Anna, my girlfriend, has a medical doctor that you can do Western medicine tests, and there are markers. So you can see where the damage was done. Okay, I can't tell you much more than that. There was a webinar only in Spanish. We got to translate it. Once the damage is done, then the next question is, what do you do about it? And as far as the doctor who did the presentation was concerned, the doctor said, you pray, you live every day like it's your last, which is what we should all be doing anyways. But that sucks, that I know a person right now, a very nice woman, that has been scared shitless for years. So scared that she, injected herself with some poisonous substances that then caused her to have a blood clot in her brain where she almost died. And the reality is I don't know. These things can be floating around. Like she's got to be on blood thinners, so with clots and things like that. But I have no idea. And right now, this is the conversation. I'm now reaching out to several different people from around the world. I know, my girlfriend knows, that have had lots of real world experience on what do we do for these people, because I don't want to just look at the history form and go, oh, you got vaccinated, there's nothing we can do for you, good luck, here's your money back.
Yeah, I feel the same way, man. I'm always trying to come up with solutions and trying to help those people, and it seems, it sucks that there are people hopeless out there.
Well, here's the thing too, there's always got to be hope. Okay, if you've gone through something like this and you have no hope, that's not going to help. And my dad would always say there's no such thing as false hope. Right? If you've got hope, you have hope, and that's energy for your experience. So hope, you have to have hope. That's the other thing. That's the other business I'm in, is the business of hope.
Yeah.
And if you don't have it, then you give up. If you give up, well, the way the body works is there's a certain point in time when the body realizes, okay, we're not surviving, so I guess it's time to decompose and die. Your body just does that. There's this fine line of we're helping, working, and too much. So then the body goes, okay, well, I guess it's time for us to just stop. When your body is going through cancer, it's not that there's poison in the body and the things like this, that the cells are getting poisoned and they're cancerous. The body is doing what it's supposed to do. It's natural. And my dad realized that when he was trying to fight cancer, he was working against what the body was doing. So then he learned more about the body so he could support the body. All right. And we could support, he was doing low dose radiation initially in Mexico because they wouldn't allow you to do that in the States. So, they get to the tumor or whatever, and then he was supporting the body naturally. And his patients wouldn't lose their hair, things like that, And the reality is, as long as we get to it early enough, there's a lot that can be done, big time, depending on the person. Because if you hear you got cancer and you just give up, then your body goes, okay. I mean, that's it. That's it, dude. If you just give up, your body follows.
Yeah. Yeah.
I mean, it's not simple.
I know people who just they acted like it was not the end of the world, and they didn't do the chemo. They didn't do that, and they're still fine.
There's older people. It's funny where it's like they're in their 70s and 80s. And it's like the chemo is going to tax the system so bad. Let it be. And tell them, go get some joy. And they start dancing and laughing and going on cruises, and they live. It's kind of weird.
Yeah.
It's the same thing with all this stuff now too, okay? How many people got wrapped up in the ridiculousness over the last 3 years? And did they get sick? Piece of cake, right? I didn't get wrapped up in it. My brother, he's not interested at all. He doesn't even want to talk about it. Like, that's the deal. It's like, he doesn't want to give it any energy. And look at all these people. It's their life. It's their focus. This is a waste of time. It's a distraction, dude. Big distraction. And nobody on the other side is fighting against our side, claiming nanotechnology and graphene and all this shit. They're just laughing their asses off. These idiots running around in circles. Dumb.
Yeah.
Yeah. And there's a couple things too. I'll tell you this one. There was an experiment someone my girlfriend knows about where they took a little robot, has no consciousness, right? And they put it in with a bunch of little baby chickens. And after a while, the robot was following the chickens around. All right. So the consciousness, we have more developed consciousness than that of a baby chicken. All right. Baby chickens were able to manipulate robots. Now, people think that they're going to put these micro technology things in there, just like the movies, and it's going to control us. Not if you're not going to let it. And by the way, like I said, that's not how it works. Yeah, there's self-assembling nanotechnology. They're not using it in your body. Or if they are, that's not the deal right now. They don't need to. There's no need to do that with us.
I think it's something. I don't know if it's nanotechnology, but it's definitely.
It's a population control thing. They took out how much of the population? I mean, for Bill Gates say it, there's too many people. Dude, give me a break.
I think it's something.
There's not enough food.
Yeah, I think it's something more spiritual. Even Steiner said that they, he talked about it 100 years ago. Separating the soul from the body and all that. I feel like there's truth in that, but maybe we can't see it in the form of microchips or whatever they're saying. I don't know.
My girlfriend will get deep into that with you. As far as those that want to live forever. But they have done certain things and their soul is not coming back. So,
Mm.
and this is where I can't get too deep on that. It's like
Yeah.
my girlfriend will go deep, 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 and I get it. It makes sense.
Yeah.
I just have to live here and now.
Yeah.
You know what I mean?
But to credit what you're saying, I think ultimately we have to sort of give our energy to whatever, and not giving your energy that plays a big part in helping you.
Yeah.
Right.
And it's where do we give our power too?
Yes.
Why not trust your gut? It's a big deal. We've been taught not to trust ourselves, to trust experts. And nobody's an expert in you other than you. You know yourself better than anybody. And it's amazing how often I should have trusted my gut, and look what would have happened. You know what I mean? We question ourselves, and that's part of what's going on with us. We shouldn't. Live your damn life. Know what it is that you want. If you don't know, then figure it out. Life is about experience. Every day, we all could be dying every day. Actually, we've all been dying since the day we were born, right? We're all headed that way. The question is, what do we do with our days? What do we focus on? I want to focus on living. I like living. I like people. I like learning. I like connecting dots. I love being outside in nature. I like eating. These are things that are fun. I don't
Your
like watching
tacos look
videos.
amazing, dude. You sent me some pictures of those tacos. Oh my God. I want to
Yes.
fly down to Mexico and grab some.
Come on down, man. Tacos. And like I said, Mexico, lowest cancer rates in the world. And what's funny is Dr. Pablo Campra, who wrote the first graphene paper, I met him. He was doing a presentation on the anti-cancer properties of gazpacho. He did a study of why Mexico has some of the lowest cancer rates in the world. And you know what part of it is? The attitude. Mañana. Mañana. How much stress is going on in the States, dude?
Yeah.
Stress in the States, the horrible food. People here can't afford glyphosate and things like that, which is awesome.
They can't afford life. That's funny.
Gotta love it, dude. But Viva Mexico, right? Viva poor people. Yay. But it's all food for thought. In the end, what do we do? You do a podcast, which is great. You're feeding your vibration, you're feeding your mind, you're thinking, you're actively living your life. You're not just sitting back going, oh my God, they told me this. Oh my God, they told me that. Oh my God, I have to do this because they told me this.
Yeah.
You're going through the experience, which is a good thing. So I'm not saying don't listen to people, but if you listen to people, I always tell people with what we do, don't take my word for it. When I do a consultation with you, go act on what your blood said and let me know what happens.
Yeah.
No pressure. Or not. As we've always said this, you get the consultation, you can take that cool piece of paper and act on it, or you can shove it right up your ass. It's up to you, right? So in the end, who's an expert? My dad has a great saying where he says, when he says Western medicine hasn't found the cause or cure of one chronic disease in over 100 years, he says, then if your car had a transmission problem and your mechanic has never fixed a transmission in his life, would you take your car to him? Would you ask his expert opinion?
And if I use this analogy, if they told you the tires you were going to buy for your car were the third leading cause of death, would you put them on your car?
Yeah.
Because doctors are.
Oh my God. Come on. Honestly, really. And it's funny. You look at the numbers and where's all the leading causes of death are all lifestyle.
Yeah.
It's all lifestyle stuff. And then doctors,
but medical error is huge. 250,000 plus. Yeah.
Yep.
A year.
I know. And like I said, doctors, I don't blame them. They want to help people. So at this point, still, what do? We learn about our bodies. We learn how to be healthy. And health, nature provides all that we need. Every action equal and opposite reaction. So if you introduce something into the system that's not there or supposed to be there, it could potentially create a reaction that's not supposed to be there. It's the simple things like that. And really, in the end, too, there's things like, who are you listening to? There's good science and there's bad science.
Yeah, on all sides. All sides. Nobody knows what the hell they're talking about.
Right. And I'm so concerned with that. This is one reason I haven't said some of these things, is because I want to make sure first. And I don't know everything. But I know, if nothing else, that with what I do, it's replicable. We've done it for decades. And we were in Spain, we did the big lecture, and there was a guy there, he's one of my girlfriend's heroes, and he said, we need to be scientists like the Bigelsens. And I had the little translator earpiece in, and I said, did he just call us scientists? She was like, yeah. And he said, they have a method that's replicable, repeatable. They've observed patterns. That's it. Now, I know that there's the scientific method. There's Koch's postulates, which no one has ever fulfilled, right? So what's good science? What is taught science? What is real science? What is bad science? I think when people share things that are fearful, create confusion, and make us helpless, that's not really good stuff to share. Okay? Science is about, these were the notes with my girlfriend, science is about being humble, having discussions, admitting that you're wrong, looking for
Yeah.
patterns, not going, oh my God, I found it, and not having a discussion with anyone about it.
Mm-hmm.
All right. I can't be arrogant with this. And it's, you feel my passion, my energy, my
Yeah.
frustration. It hasn't been easy. I just want to help people and do our thing. And I see people, there's one side of the fence that believes in poisoning. There's another side. There's mainstream and there's upstream. And then on the upstream side, there's a mainstream there too as well.
Yeah. Oh, yeah. It's so convoluted. I mean, I could do a whole podcast on that alone.
Yeah, you could.
But as for science, again, at the end of the day, too, it's the language of matter and nothing more than that. And I think it's very limited, and it can
It
limit
is.
people if they stop
Yes.
in that one place and they
Yes.
don't go any further. Right?
You got it. You got it. You got it. That's it, man. And in the end, too, it's like I'm easy. You can believe whatever you want to believe. I would rather have you believe something that makes you feel good and makes sense than something that confuses you. At the end, it's up to you. You believe whatever the hell you want to believe. I'd like to think after the conversation, we talk about you can't see nanotechnology, right, with this microscope. And then as soon as message and messenger, okay, someone says it's nanotechnology. Well, they're wrong. So then they're going to say something else. Are you going to believe the next thing they say? I mean, part of it is patterns. I've seen these things for decades. Comes out of capillaries. It's not physical. It's not hydrogel. It doesn't work that way. These people are altering their samples, which is bizarre. There's fear. There's arrogance there.
Yeah.
So in the end, like I said, and I see people here. There's a senior group here, and they're creating a truthers website, right? And they're going to post all about graphene. And I said, how do you know that's the truth? Well, that's their truth.
Yeah.
So at this point, it's not my truth, and it's up to you and your people listening. If people don't hear what I said as far as the nano experience and the size and the experience I've had, and they want to listen to these people, that's okay. I consider them adamantly ignorant, that you're not interested in the truth. Like you said, it's like, can't we consider this moot if we just say you can't see nano with these microscopes? Yep, we sure can. Once again, they didn't isolate anything, so I'm done. Nothing's isolated. They don't care about your health. I'm done.
Mm-hmm.
Where else do I need to go? So at this point, I feel good about what I say when I can say it to people, knowing that they can feel a sense of relief.
Mm-hmm.
So that's my hope. And all this is that as people listen to this with you, someone goes, oh, I get it. That makes sense. I've been waiting for someone to say that. Mm-hmm. I had someone, she was a doctor too. She said, I want to learn dark field. She signed up for the course. She became so depressed with the darkness that she got into, with them telling her about all this stuff. And then she found us and she was crying. She's like, you guys are awesome. There's hope. There's no agenda with us. I mean, I'm not here to be rich. My dad was rich. He wasn't happy. I want to help people. I like some new microscopes. That would be nice, I like some more tacos.
Well, I'd be interested in seeing what you find with a nanoscope, right? Like you said, if we're not really seeing on the nano scale, then there's potentially more to find, right?
Yeah. And two, like I said, don't do it. Don't be a part of the experiment. And you'll laugh because like even Spain right now, Spain said, we never said it was mandatory. Yeah, good job, right? So did you believe? I don't believe in my government. No how, no way. Mexican government, I believe in more. Which is interesting to say that, but that's a whole other story,
Yeah.
But I feel for people, Patrick. I appreciate you listening. Yeah. And it was funny because initially I was just trying to promote my course, and I went to Infectious Myth 3.0, and first thing I see is your webinar, your podcast, which I think you asked us to be on, and I think my brother just filtered it and I never saw it because you had Anna on. But then as I reached out, I said, no, they're wrong. And you responded in a way that was good, that I felt like we could have a discussion. And it was funny because I said, let's chat. And you were like, cool, I need to record it. And I was like, no. We're just going to chat. you
Hmm.
know. So I appreciate you listening to me, you know, and you could see I don't get to say what I need to say as often as I'd like to. Yay.
Yeah, absolutely.
So this was, well, I was a little nervous about being on to talk about some of these things.
Nah,
I
you're in good
was, you
hands
know,
here.
and well, and the thing is too, with people listening, I'm not here to argue. You know, you want to argue, go somewhere else. You know, you want
I
to,
don't think I have one argument on my whole podcast, man. I'm really like about giving people the floor, and like at the end of the day, people can use their discernment, and we get, it is science, right? Like you take this side of things, you take this side of things, you compare.
yeah. Well, and you'll laugh at this because end of COVID with Mike Winter and Alex Zeck, when they invited us, we saw that they had invited her as well. And we had a webinar, or we had a Zoom call with them, and we said, dude, not cool. Like, you're not
Yeah.
ending COVID with this woman.
How many times have they ended COVID?
Right. I think I like, you know what I like what those guys did with end of COVID? And my friend Brendan Murphy reminded me. Someone asked me a question one day. He said, Adam, they can find the answer in the end of COVID. And I was like, oh, yes, this means I don't have to talk about it anymore. Go watch End of COVID. It's all there somewhere, right? Except
Yeah.
don't watch that one. So the
Right.
funny thing is, yeah, we were not happy with that. We almost didn't participate. You know, they said, look, we need your voice here, you know. And then it was kind of like we were pissed, you know. And at one point, Mike Winter said, well, look, you know, we just want to present the information, then people can make their own decisions. And I support that. But I don't support presenting incorrect, false information for people to choose from.
Yeah. And
That's
for me, that conversation ended a long time ago, kind of like the constant reiteration of the same information and like people just getting rich off of it is not my thing personally. That's just
Yeah.
my opinion
No,
on
it's
it.
not my thing either. And it's
Yeah.
what I've noticed is in the communities that I'm in these days, no one's talking about this stuff anymore.
Yeah.
You know, I have people that send me stuff periodically, and like I said, Brendan Murphy said it too. He said, we need your voice here. And I think you said it. You said there's no one challenging these people. And I think you're the only one who can. And
Yeah.
I am. And I feel a responsibility to that, you know, and I think it's affected my jaw. I think it's affected my health a little bit. That I
Yeah.
have something that needs to be said, and I have something that people need to hear. I have something that people want to hear. Any little piece of light that can be shed on things right now is a big deal. And if you can start to see the little light, then the door can open that much more. But yeah, I appreciate you being here. I appreciate anyone that
Yeah.
you have listening to you, you know.
Yeah, thank you, man. I really appreciate you taking the time. It was a really interesting topic for me, and seeing that stuff in the blood, amazing. So before I let you go here, where can people sign up for your course, check you
Yes.
out, continue looking at your work, all that stuff?
Thank you for asking that question. This
Yes.
is how horrible of a marketer I am. Okay,
Oh,
I'm
I knew
actually
it.
the last person who came to get the blood done left, and I didn't even charge them. You know, it's like I forgot to ask for money. So thank you for helping me support my experience. Yes.
Absolutely.
Good question. You can go to bigelsenacademy.com. It's B as in boy, Igelsen. If you type up my last name, you'll find all kinds of stuff out there on us. You'll see my dad on Quackwatch, Guy MTV, and things like that. But if you want to help, you know, we have a few books. If you want to help yourself, read my dad's holographic blood book and Doctors Are More Harmful Than Germs. So relevant right now, crazy. Very easy reads also. I don't make a ton of money on those, but that just helps get the word out, which is nice. Josh and I have 2 training courses, both based on those books. So one starts again in September based on the holographic blood book. We call it Introduction to the Terrain Paradigm through the Bigelsen Method of Holographic Blood, because we are all terrain. Then the second one we just launched last week is The Hidden Side of Healthcare, which is based on my dad's book, Doctors Are More Harmful Than Germs, How Surgery Can Be Hazardous to Your Health and What to Do About it. Awesome book. Basically, each week we go through a chapter or 2. We've got lots of material. I videotaped my dad. We've got radio shows with him and interviews. So he's teaching, which is awesome. So it's the book, then it's supplemental material to reinforce. There's tools, things you can use and try. And then there's webinars once a week for Q&A discussion.
Cool.
And it's awesome. You know, I think the best thing you can do is learn how your body works, educate and empower yourself, and get some damn joy. If you do nothing else, don't send me your blood. Get to an osteopath or craniosacral person. Get some body work, right? Get some damn joy in your life. And then things start to change.
Absolutely.
You can adjust your scars and other things too, but one thing at a time, right?
No. Great
Yes.
message to end on there. Yeah. And I want to thank everybody for listening to this podcast. And if you feel so inclined, I guess I should market myself. You can donate to the show. That's what we thrive on. Buymeacoffee.com link is in the caption as always. And yeah, make sure you visit Adam and check out his work. Yes. Thanks so much again, man. And come back when you buy that nanoscope and you find out new stuff.
Stuff to show you. I'll let you know. Yeah.
Awesome.